Good morning, everyone, and welcome to today's gathering as we come together on World Mental Health Day as well as World Homeless Day. Before introducing today's topic and our esteemed panelists, I'd like to invite some students from MSSW for the Tamil prayer song. If everyone who is able to can stand up for the Tamil prayer song. Thank you.
நீராடும் கடலுடுத்த நிலமடந்த எழிலொழுகும் சீராடும் தகலமிக திகழ்வடந்த கண்டமிது தெக்கணமும் அதிசிறந்த திராவிடனல் திருநாடும் தக்க சிறு பிறை நுதலும் தரித்தனமும் திகழமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க எரிந்த பெரும் தமிழனகே தமிழனகே உன் சீரிலமை திறம் வியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Thank you. Thank you, students. Thanks, Dr. Lakshmi Shankaran, for joining them. Our discussion today hopes to bring together the diverse perspectives at the intersection of homelessness, mental health, and workplace wellness. With the background and the context in which the Banyan works, specifically in the field of mental health with homeless persons living with mental illness, this discussion will center stage conversations around workplace wellness and from members of organizations that offer affirmative employment opportunities, and also hear from one of our former service users who will shed light on creating communities of care for mental well-being, as well as stakeholders from the government. We are grateful to all our panelists who bring to the table years of practical experience in their respective fields and foreground real-world challenges and solutions around workplace well-being. Today's session will be moderated by Dr. Archana Padmakar. She is the co-director at the Banyan with more than 18 years of experience as a clinician working with vulnerable populations. Dr. Padmakar has oversight over all programs and operations at the Banyan, but specifically she has dedicated herself to the scale-up of the Emergency Care and Recovery Center program, where acute care mental health care services are offered to homeless people living with mental illness. Dr. Padmakar, if you can join us. Thank you. My colleague Kirtana and I will be introducing the panelists. We have 8 panelists with us today, so we're going to take to introduce 4 each. I'd like to first welcome Mr. Madhusudhan Reddy, an IS officer from the Tamil Nadu Cadre 2011 batch, currently serving as the Director of Survey and Settlement in Chennai since June 23. Mr. Reddy has held key roles including Sub-Collector of Perambalur, Joint Commissioner of Land Administration, and District Collector of Shivagangai. Notable contributions include designing the Tamil Neelam online land records mutation system, leading public health crisis management during COVID-19, and implementing a waste-to-wealth biogas project recognized by the Prime Minister. Mr. Reddy has also received the Best Collector Award in 2022 for service to the differently abled. Welcome, Mr. Reddy. Please welcome Dr. P. Vijayakumar, IPS, a medical doctor who graduated from Madras Medical College, a pediatrician by training. His passion for policing and law enforcement motivated him to take up civil services. He is currently holding the post of Joint Commissioner West, Greater Chennai Police. He has previously worked in Thanjavur, Kadalur and Krishnagiri districts as ASP, in Vellore, Tirupattur and Chengalpet districts as SP. Dr. Vijayakumar was part of the Home Ministry for 2 years in Delhi, and before his current posting, he was working as Joint Commissioner Avadi for 1 year. He is an avid traveler and biker. Welcome, Dr. Vijayakumar. Please next welcome Mr. Naresh Ramasubramaniam, a textile technocrat with over 3 decades of experience, who began his entrepreneurial journey at the age of 26, selling textile machinery and establishing large projects. He co-founded Shuttles and Needles, a first-of-its-kind experiential center for textile arts with designer Kalyani Pramod. The studio collaborates with 40 NGOs, supplying subsidized looms and materials and offering free training for educators and parents of individuals with intellectual and developmental disabilities. He has also helped form Weavin, an association supporting weaving programs for disabled adults. Welcome, Mr. Naresh. Next, please welcome to the stage Mr. R. Karthikeyan, the CEO, Managing Director and Managing Trustee of Worth Trust, a social organization supporting specially abled individuals through rehabilitation, education, vocational training, and employment for over 6 decades. Leading the trust since 2015, he actively promotes inclusion, empowerment, and gender parity among employers and corporates. He is a member of Tamil Nadu State Advisory Committee for the Employment of Differently Abled Individuals. Under his leadership, Worth Trust has received numerous national and state level accolades for its work in the social sector. Welcome, sir.
Hello everyone. I would like to invite Ms. Sharada. Ms. Sharada Dharmaraj has been with Writers Cafe since 2017, advancing from assistant manager to brand development manager. She specializes in customer care and works closely with special individuals employed at the cafe, fostering an inclusive and supportive environment. We welcome you, ma'am. Next, I would like to invite Dr. Damen Queen. She holds a doctorate degree in social work, specializing in medical and psychiatry with 13 years of experience. She spent 3 years in the field working on women's development and advocacy and over 10 years in social work education. Currently an associate professor, she teaches medical and psychiatric social work while also serving as a trainer and a crisis counselor. So her approach is pragmatic, focusing on resilience and strength-based interventions for individuals and groups. So extensive work has developed her expertise in women's development and crisis management. We welcome you, ma'am. Next, Mr. Shibu Albert, sir, with over 25 years of experience, is a seasoned professional in IT software, infrastructure management, project management, CSR management, and skill development. Since 2012, he has led leadership roles at Tata Institute of Social Sciences, Mumbai, where he led key initiatives like the School of Vocational Educational, National CSR Hub, and National University Student Skill Development Program. He automated TIS operations, improving efficiency. Before TIS, he launched IT ventures focused on software solutions and data center management. And at present, he is the Associate Director of the Livelihoods at the Banyan. We welcome you, sir. Ms. Premavathy is a pharmacist with 20 years of experience in both hospital and retail pharmacy settings. Throughout her journey, she faced mental health challenges and courageously sought treatment. Having successfully battled mental illness, she embodies independence and resilience, drawing on her lived experience. We welcome you all.
So good morning, everyone. I think, so for this year, the World Mental Health Day theme is based on mental health at work, which is an important theme for all of us as students, as professionals, and also as part of the government leadership as well. Now, today's panel discussion will focus on within the context of homeless people with severe mental health issues. Thereby, as we all know, stable housing and stable income are the most important implications as far as one's quality of life is concerned, as far as one's psychological well-being is concerned. Keeping at it, we need to understand that in India, several studies have also quoted saying that about 42 to 73% is the percentage of employment rate with persons with several categories of disabilities versus 8.2% of the general Indian population. So if that's the case, I think as a panel, we also need to kind of integrate our different disciplines together in terms of how we can curate a workplace that is more conducive for people with several disabilities. At the same time, from a governance point of view, what we can do in terms of creating a lot more conducive workspaces for people when they come in with a lot of difficulties beyond their mental health recovery. The government can provide resources to help with mental health issues and also people who are mental health users in order to find employment at right workplaces. So the first question that we pose is for Mr. Madhusudhan Reddy in terms of how do you envision the integration of government governance with initiatives in terms of strengthening health systems for homeless individuals facing mental health challenges? If you could throw light on your experiences, sir.
Good morning to all the panelists and people sitting here. See, basically, the mental health as such, there is very, very low level of awareness among the community, and for ourselves, the detection of itself is very, very difficult because the manifestation of the symptoms it takes very long time. Here Dr. Vijayakumar is also, as a medical doctor, he can supplement me. But by the time it becomes aggravated, only people start realizing that he has some problem. And within our society also, if it is coupled with the poverty, then it is very, very difficult for them to access the treatment facilities because of lack of understanding among the majority of the population. They think it has a religious issue and it has certain religious connotations also. They don't seek the medical advice, rather they are seeking the care through the religious institutions. So in such a scenario, we have to understand it holistically, the concerns of the society about this mental health challenges. What exactly is the problem being faced, how to handle it, and what kind of treatment rehabilitation efforts are needed to these people. I would just focus on these issues. When it comes to homeless people, mostly they are left out by the family, discarded by the family. The family itself is not homeless, but the person affected by the mental health has been made homeless. For example, people from outside Tamil Nadu drop their family member once they are affected and very highly aggravatedly affected. If they are very poor people who are not aware of the problem and who are not aware of the curing mechanisms, they just drop in the railway station and leave. We have rescued a lot of people. Still the rescue operations are being done by the Chennai Corporation in consultation and coordination with the Greater Chennai Police. Most of these, our central and Egmore railway stations will find a lot of people like this. And unfortunate thing is, some of them have been made as people accustomed to the community living there. If they have gone inside one community and staying on that footpath, most of the people with the grown up bad and very long hair and all, if you see them, so அவங்க எல்லாமே வந்து மேக்ஸிமம் வந்து அதை வந்து ஒரு சாமியாராகவே ஆக்கிட்டாங்க. நம்ம ஆளுங்க வந்து அங்கே போயிட்டு வந்து அவரை கூப்பிட்டு வந்து நம்ம வந்து அவருக்கு இது பண்ணி ட்ரிம் எல்லாமே பண்ணிவிட்டு ரெடி பண்ணி ஹாஸ்பிட்டல் கொண்டு போனதுக்கப்புறமா தெரியும் இவருக்கு வந்து ஆக்சுவலி மென்டல் ஹெல்த் ப்ராப்ளம் இருக்குது. ஸோ அவருக்கு இந்த ரெஸ்கியூ அண்ட் ரிஹாபிலிட்டேஷன் ஹோம்ஸ் கவர்மெண்ட் இஸ் ரன்னிங். Chennai Communicable Diseases Hospital at Tandeyarpet, we have 2 homes for them. So அங்கே ஒரு 6 months, 1 year அவங்கள வந்து psychiatric drugs, here pharmacist is also there, so she can tell, they themselves cannot take, so we need a caretaker. So it all comes with a cost. So it is all provided by the government free of cost for these homeless people, the rescuing of them, rehabilitating them and reintegrating them with their families back. We have again traced their natives, where they are from, because he can consciously tell all his previous story only when he is cured. Otherwise he will be telling something off the radar, whatever he thinks, he will not exactly be able to recollect his past, or he will not be able to tell exactly where his whereabouts. We have integrated a lot of people to other states, including UP, Andhra Pradesh or Karnataka, because from outside they are inbound to Tamil Nadu. This has been observed at Perambalur also. Perambalur is a very small place. Even then, people of this kind of very aggressive mental health behavior being noticed on the streets. So government has started for this purpose only National Mental Health Program and the District Mental Health Program. These cases where we see the homeless people affected by mental health on the road are an extreme cases. And when it comes to the mild cases, what Archana referred to, the workplace issues, or to our own family members, including small depression and other kind of aggressive behaviors, it has both extremes. You will have a very depressive attitude also, very hyper attitude also. So both kinds of issues have to be dealt with, including the workplace stress. To stress this point, we need to stress on the community health programs so that community advocacy is built up and awareness is created among the people. To do this, as part of the district mental health program, the doctors visit all the PHCs and the community health centers. They observe the people coming to the outpatient care and inpatient care also. Then they'll pick up who all probably might have the issues and put them on the treatment. It is very, very easily curable problem. It is not that it requires a surgery or it requires a major complications, nothing. It just requires a regular drug intake at an appropriate intervals with a proper observation by somebody. It can be a family member, it can be a friend, or it can be some social worker. And the interesting part is, since you are all part of this Madras School of Social Work, and most of these rescue workers, rehabilitating people and people associated with reintegration are from this institution or from the background of the MSc, your social work only. So you will be playing a very crucial role if you are interested to play in this aspect also. And workplace issues, it's a completely different issue compared to these homeless mental health problems, because workplace issues start from overworking or kind of different kinds of people you interact with in your working institution. So it's a different platform all together. And in rescuing, the problem is that when the person is a homeless person, the disease has become very aggressive, then rescuing itself, on certain occasions we have to take police help and send 3-4 police personnel along with the doctor and along with the local revenue officials and bring them in a proper vehicle and then admit to the first treatment. Earlier it used to require a mandatory registration of FIR. Now that mandatory thing has been removed, it can be just an intimation to the local police station so that they are also aware and can help in the rescue and rehabilitation efforts. So this whole 3 issues, unless the rescue, rehabilitation and reintegration is not done, the homeless people who are affected with the mental health problems cannot be taken care well. So that's where the part of the government comes in, and the part of the society or individuals like us comes in. When we spot them, please call 108 and tell I saw somebody, or you call some local contact numbers which are being published for this purpose by the health department or the local administration. They'll come and rescue them. You need not go near them, or you need not personally rescue. And information itself will help their lives to be stabilized, treated and become normal again. Thank you.
Thank you, sir. So to summarize what sir has told us, he started off with focusing on re-emphasizing on early identification, also on low levels of awareness within the community, and also the need for interaction between different stakeholders, especially when there's an intersection between poverty and population who live below the poverty line. And especially the manifestation of symptoms is so diverse, especially when people from other states also coming into Tamil Nadu and vice versa. If that's the case, then we need to curate care paradigms accordingly to that. And representing the government, he emphasized on the role of Greater Chennai Corporation integrated with the Law and Order Department as well, and also the role and interventions of the National Mental Health Program and the District Mental Health Program as well. And also spoke about strengthening the community advocacy in terms of how the youth can play a crucial role in terms of identifying people who are homeless and with mental health issues, and how you people can come forward in terms of seeking out support and advocating for the person who is probably in a lot more distress. Thank you, sir, for that. Each of the participants, you will get about 6 to 7 minutes to speak on your specific topic that has been assigned to you. Next question, relating to the role of law and order and its role in Greater Chennai Corporation and its integral role in terms of addressing homeless people with severe mental health issues in Chennai. The next question is for Mr. Vijayakumar. How has law enforcement, sir, in terms of how they have been responding to homelessness in the city, especially when there are a lot more unsheltered homeless population? This population continues to increase over a period of time. That's what we've seen as an organization as well, who's been in this field for about 3 decades now. So how do you see in terms of addressing the intersection of homelessness and mental health in our Chennai city?
Very good morning to all the panelists, all the students, and thank you for the kind introduction, madam. And it's a pleasure to be in this dais and interacting with you all. The question itself, it's a kind of having heavy burden, the intersection of homelessness and mental illness. India is a society where intersection plays a key role. Wherever there are disadvantaged, the question of gender comes in, the question of caste comes in, the question of geographical location comes in. So the intersection is an important nuance in addressing any issue, especially in a society like India. And when it comes to enforcing the laws connected to the particular issue, homelessness, and it has evolved, the issue has been addressed by the state in different perspectives over a period of time. Earlier, it was stigmatized, it was criminalized. Being a beggar is criminalized. We have an act in 1954, which was amended in 1964, Prevention of Beggary. And the people who are roaming in the roads, seeking alms, are picked up by police, put up in a vehicle, produced before magistrate. The magistrate will fine 50 rupees. He will fine a beggar 50 rupees. That was the law. And he may be taken to a center. Tiruvallur, earlier it was there. Now kind of because of Supreme Court's directions and changing of perspective of the governments, slowly it has been decriminalized. And what does a homeless person want actually? Do he want 4 walls, a roof over his head? Yes, definitely. What is more important to him? He may need a reconstruction of his amputated soul. He needs a healing of his injured soul. That is what he needs first. Somebody is thrown on the street and he won't be having his normal mind at all. So for all practical purposes, any wanderer on the street, any homeless person is also a kind of damaged mental components, mental faculty of the individual. So it is a comprehensive thing addressing the needs of a homeless person and a mentally ill, also a mentally ill person. When it comes to policing, the first thing is the police have to look at what are the laws in place to enforce to deal this issue. As such, we don't have any laws for the police to enforce to deal with the mentally ill and homeless person. Now we have 2017 Mental Health Act, which is also the perspective have changed. It was a rights-based act, a social legislation it is. The law demands there are a lot of rights for the mentally ill person, and that rights has to be protected by whoever enforces the law. For policing, there are 5 sections, from section 100 to 105. What does it say? It says, any mentally ill person found in the jurisdiction of a local police station, he has to be identified and taken into protection. The word conveys a lot of meaning. The police have to take them under protection. Normally what police people know, as policemen we know, to arrest a person, take them into custody. But it very interestingly says they have to be taken under protection. They have to be not taken under custody or have to be arrested. And then after taking under protection, they have to be taken to a hospital where assessment will be done. And after assessment, if warranted, they have to be admitted. So what is the role of police in the whole scheme of things? The police acts as a first responder. If it is a first responder, the police have to decide whose problem it is. To what extent the police have to bear the burden or to bear the issue of resolving the challenge. It is only the police who gets a call at 2 a.m. No other stakeholder will be getting it. At 3 o'clock, police will be getting a call in the bus stand. Though there are a lot of agencies, multi-stakeholders are working on it to address the issue, it is only the police who gets the phone call, and the first instance of interaction lies with the police department. So the role of police is very big. Though the responsibility is heavy on the other stakeholders for resolving the issue, for long-term rehabilitation, so first responder, the responsibility is huge for the police. The Chennai City Police in the year 2021 has come out with a novel program, Kaval Karangal. This Kaval Karangal, because of the robust process and the officer's interest, the then Commissioner of Police Chennai City, who is now currently the DGP of Tamil Nadu State, has initiated this program. This is basically bringing all the stakeholders in one table. So he put up a process in place wherein the police initiate the whole scheme of rescuing, rehabilitating, providing them the medical assistance, and taking efforts to communicating, finding out their actual homes, and if possible, to reunite them with their families, biological families. That was a successful program till this date. In this 3 years period, more than 8,000 persons who are wandering in the streets have been identified, and they were rescued, and they were given medical attention and psychological counseling wherever needed. Around 800 were admitted as inpatients to treat the mental illness. And in tie-up with Apnagar is a big NGO in Bharatpur in Rajasthan. We have an MOU with this Apnagar in Rajasthan. And once a year we take the persons who have come away, as Madhusudhan said, the persons who have come from northern part of India, the southern part. They wanted to, the families, sometimes, that is what our collective concerns of our society is. They want to get rid of the mentally ill person. Nera kondu station la recruited thirumba poiduvanga the train. So they were around 400 people were put in a train, taken to Rajasthan. They were staying there. After giving all the required assistance needed, and the team there were trying to find out their homes, and they found their family member in a better mental condition. They have taken them back. It was a kind of a happy, and it was a very delicate, very poignant story of, it's every single person is a human. He will have a lot of stories to tell about his family, siblings, and other members. It's a world for himself. Though we count in numbers, 8,000, 5,000 solron nama, but every single person do have his own world of life. So around 400 were reunited. And similarly, Namurli will go to the northern parts and leave them there. So we bring around 300 persons from that Apnagar, Rajasthan. We manage to identify their families here, and if they are willing, and they'll be reunited. If they are not willing, no problem. We have other assistance from the government, right from the shelter homes to other homes, hospitals being run by the state. Anga we have made to accommodate them with kind of a better living conditions. So on the Madri Pannadilla, still it is going on. We have a 24/7 helpline number 9444 7171000. This is a 24/7 helpline number. Whoever calls this number, and it will be noted, the information is noted. We have a dedicated 7 vehicle and teams in place. The vehicles will reach the spot, and immediately they will be taken to a shelter homes wherever it is needed. Immediately, if need be, to the hospitals, and 120 dedicated volunteers are working. And the students from this institute are also being interned there. They are doing an internship in this Kaval Karangal program. And it is kind of a collaboration and partnership with other stakeholders, including these volunteers, NGOs, shelter homes, GCC authorities, and other NGOs in other parts of the country, and providing them all the assistance needed. It is a step beyond the statute in force, and this program is of the government considered this this program a successful one, and they have awarded Honorable Chief Minister Award also for the best practices, and this is being replicated around the state now. Earlier it was started by the then Commissioner of Police, now it is being replicated throughout the state by the government. So the data 2011 census says there are 6,800 homeless people in Tamil Nadu. But this program itself, we have identified 6,000, around 7,500 persons so far wandering in the streets without home, and managed to provide all the assistance needed to them. So in sum, the role of police is kind of a first responder, and what is needed for that, and we need beyond the authority of law to enforce the statute, the concerned police authorities do have a component of compassion and empathy to enforce the law with a humane mind. That is what needed, especially this is not a statute to prevent an offense. This is a law to protect the rights of the individuals. So keeping this in mind, the police department is included this component in the training of the police officers at various levels, and slowly this is a starting point, and there are a lot of gaps into it. Over a period of time, I am sure that police department will carve a suitable place in the whole scheme of things. So as a first responder, we do a better job. So thank you very much for this opportunity. Thank you very much.
So thank you, sir. To summarize, the role of law and order is being like a first responder. Also, he said that it's a very comprehensive issue. Therefore, bringing in different stakeholders and working with different sectors is a key suggestion that he's proposing as part of our Chennai city homeless people and people with severe mental health issues is concerned. He also suggested that the role of Kaval Karangal has been quite significant in terms of identifying people who are homeless in the city. At the same time, we are in a position to offer the kind of psychosocial support that is required, referring them for early care in different hospitals and NGOs. And at the same time, he also did emphasize that there are no laws that are specific to in terms of implementing the law and order regulations in terms of mental health is concerned. But he also emphasized that the Mental Health Care Act 2017, that's the most recent act that we have, which has section 100 to 105, which is what they bank on in terms of understanding, in terms of bringing in a homeless person, especially with severe mental health issue. We have two special officers here today. I would say that Mr. Madhusudhan was instrumental after we signed the first MOU with the National Health Mission with the Tamil Nadu government. He was the first district collector who initiated the first ECRC as part of the Tamil Nadu National Health Mission Health Department project. So very grateful to you, sir, for taking this project forward, because it also benefited a lot of people in Shivaganga who were otherwise accessing services coming all the way to Chennai. At least they were in a position to access mental health services within the district itself, within the district hospital. At the same time, Dr. Vijayakumar also has been very instrumental in associating with the Banyan in terms of giving a lot of referrals whenever his department is coming in contact with homeless people. But what we've seen another side of him is where he's been taking on a very much a humane approach in terms of referring the client, rather than not just saying that, okay, this person is here, please grab them and take them into a hospital care, but rather he's even discussed certain cases in great detail. He's also gone back and forth in terms of taking decisions whether this person needs hospital care or whether this person needs to probably be arrested because of, there are other ethical dilemmas also as law and order officials they also go through. So it's a not a strict yes or no, but rather they go back and forth in terms of coming up with a consensus in terms of what will benefit the individual most, that homeless person, because there's nobody else to advocate on behalf of the individual. So I would like to appreciate the concerns that you've taken, the initiative you've taken in terms of strengthening health systems, also strengthening the law and order department as well, as far as homeless people are concerned. Also, the John Hopkins University, in terms of a 2022, a survey also says that about 20 times homeless women have been sexually assaulted more than ever in terms of the last 10 years at least. At the same time, about 57% of them, homeless women and children, have succumbed to a lot of theft while they were sleeping on the streets. At the same time, about 78% of homeless people have been physically assaulted because they rough sleep on the streets. So it's very important for us, because as much as you can identify people and refer them, at the same time also understand what their needs are, because everybody doesn't need hospital care, everybody doesn't need some sort of a care facility, but rather some people are happier when they are homeless as well. So understanding both perspectives is very crucial. So now that we've spoken about systems and how the government has responded, we're moving to Mrs. Sharada Dharmaraj. The question that is for you is, what role can social enterprises play in normalizing discussions about mental health at the workplace?
Good afternoon, and thank you so much for having me on this very prestigious panel. Really appreciate it. Archana ma'am, could you just ask me that question again, please?
What role can social enterprises play? Like, you manage all the branches of the Writers' Cafe. So within that context, how do you think we can normalize discussions about mental health at workplace? You also worked with diverse group of disabilities working at your cafe as well. So how do you think we can respond to that need, and how you can incorporate them into your workplace?
I just want to tell you that we have no formula when it comes to integrating special individuals into our space, because our daily routines have to be adapted towards them as much as they adapt to us. So it is the main thing, not just empathy and kindness, it is the acceptance of the fact that their thought process is very different from ours. They're wired differently. They're special individuals, they're sweet children, they're sweet grown-ups, but they're totally wired differently from us. So we have to adapt to them and give them the time to adapt to us. So there is no formula. Each one is different. Each individual is different. And when we're talking about inclusivity, of course, that is very, very important. The empathy and the kindness, all that comes along with it. But the main thing is the patience. You need patience to understand the way their minds work. Every single individual is different. We work with such various spectrum of children. We work with spastic children, we work with autistic, we work with Down syndrome, we have hearing impaired, we've got the burn survivors, the women who have gone through severe domestic abuse, and burn survivors through fire, not acid. So each one of them are mentally challenged in various ways. So what we have to do is that we have to accept these challenges that they are facing. We have to take them within ourselves too. And we have to teach them skills and hone their skills and see where they can shine. Not each child can do a job. We have various departments that they might fit into, they might not fit into. Some are very happy learning how to make a pizza, some are happy to make filter coffee, where the other children can only make pastry boxes, which are very important to us, because if we don't have pastry boxes, we can't send out our products. So whatever work they do, we have to praise them for the work they do. We have an affirmation of making them feel proud of whatever work they are doing. We have to give that empowerment to those children. They are important in every single way. Whether they're challenged or not, they are part of our team, they're part of our family. So this is what is the most important thing that comes to us in mind. Because we deal with so many different spectrums of children, they're all very, very different. So we have to treat them differently and see where they fit into our departments.
Will you also be able to support with the case study? Is any inspiring story that you worked on?
Well, there are quite a few. We have a spastic child, Dinesh, who has learned from scratch how to work the machines for our popcorn. He knows how to work the machines, he knows how to caramel our popcorn, he knows how to pack our popcorn. So he's totally in charge. Please excuse me, I'm just recovering from flu, the interruption. And we have 3 of our burn survivors I have to tell you about. It's because of the mentorship that we have seen through Mr. Mahadevan, who has taught us empathy and kindness, and his son, who's his leadership, under his leadership we are working now. Because of him, we have learned how much to support the people who don't have. We take so many things for granted, we are blessed. Those children are also blessed in a different way. Now what my mentor did, he sent 3 of our burn survivors who have been with us from the very beginning. He sent 3 of them to a very prestigious school in Dubai. They joined the school for 3 months and they finished the course. He had a beautiful little studio apartment for them to live. Now I'm talking about 3 girls who have never seen they have never seen an airport. Forget planes, of course. They've never seen an airport before. He had them join this very prestigious school in Dubai and they learnt, they're so resilient, they're so strong, they're not scared of anything. They're just out there to face the world with anything. And they came back with certificates. Believe you me, before they went, I had a month of training with them. I had to teach them things like etiquette, how to cut bread, how to eat soup. They're going to a school that is full of international students. They should not be, they should know at least the minor skills of etiquette. So we had to teach them so many things, how to eat with a spoon and fork. But those girls, they adapted so fabulously, and they came back with certificates and passed theory and practicals, of course, because they've learned so much with us in our commissary. We have a brilliant commissary chef. But theory, where they don't know how to write and read so much, they came back with shiny colors. So this is what happens when they have an opportunity to go abroad. And one of those girls, as you know, I used to be an assistant manager. Now I'm looking after brand development for the company. Now one of the girls, Komala, who did go to Dubai, she has come back and now she is the pantry head of Writers Cafe, which is 7 outlets. So every day, just like me, she goes to a different outlet to check their pantries, to see whether their coffees are done correctly. She has really, this is a matter of shining, and wanting to improve and wanting to take it to another step. Who has given them the opportunity but our mentor and our leadership, Mr. Mahadevan. So this is another story I wanted to tell you. I have many to tell you, but I think I should stop talking right now and give other people the chance to speak.
Thank you, Sharada. I think they were amazing, very inspiring stories that you shared, and I'm sure you have many more. But to summarize in terms of what she has said, she banked on, it's one of the theoretical assumptions as well, where you draw support from individual differences. Don't look at them as differences, but rather look at individuals with variegated differences and challenges and draw your resources from that. And also it's important for us to adapt to them rather than expecting them to adapt to us. Despite a conducive environment or making opportunities more available, it's also important for the environment to be more empathetic, at the same time trusting in their abilities, at the same time exploring different kinds of opportunities, which is what Sharada was reflecting on. And most importantly, adaptability in terms of skills itself. This is something that we've also kind of observed in the cafe, where there is no systematic ways of quantitatively identifying what their skills are, but rather looking at, in terms of observing them, how they mobilize themselves. Mobility is what they kind of focus on as soon as they come into a cafe, or as soon as they come into a workplace, and then looking at how they integrate themselves into the bigger vision of each of their workplaces. So they do it so seamlessly, very naturally at the same time. The Banyan also has collaborated with them in terms of the CMAT canteen, which is situated in the Tamil Nadu Department of Education, where we have close to about 20 of them working as part of the cafe. And then we also have our new Semmali Punga that has been inaugurated by the Chief Minister of Tamil Nadu a couple of days ago. So we also have some of our clients working there as well. Thank you, Mrs. Sharada, for your experience, and thank you for your mentorship as well. I think that has been quite integral to the growth of every individual who walks into a cafe. Thank you. Now that we've seen the role of social enterprises, we are moving on to Mr. Naresh. So Mr. Naresh has been very instrumental in terms of creatively bringing in a very solely rooted skill, that is weaving, and also integrating that with disability. So that's a very interesting aspect that at least I came to know about a decade ago, and that's when we started working together with him. So what are the factors that can be considered while creating vocational opportunities and workplaces for individuals with mental health challenges from your experience?
Good morning to everybody, and thanks for this great opportunity to be part of this fantastic panel. Well, I think as Sharada put it, adaptability, thinking about how we are going to adapt to them rather than making them adapt to the regular thing. I think that's a key in creating the whole work environment, processes, and even what kind of vocations they can do, in my opinion. From whatever little experience I have for the past 10 years in this area, some things seem to be very clear to me. One is, if we kind of give an opportunity to be mindful, for them to be mindful, it seems to be a sustainable activity. And if that mindful activity is also therapeutic for them, nothing like that. Third thing is, I feel it should be a very enjoyable thing what they do. Otherwise, again, it doesn't sustain. They should really enjoy what they do. And the activity what they do should also bring them a lot of pride and boost their self-esteem. If you're able to choose some activity like that, I think it is really sustainable in the long run, and it can actually be self-guided. And of course, another very important spoke in the wheel in the whole thing is family acceptance and social acceptance. As Mr. Madhusudhan was telling, there's a lot of stigma in the society. There's a lot of stigma, and even for all the people here, we, as Mr. Vijayakumar was also telling, there's a lot of intersections, right? We look through prisms. There's a lot of social, stigma attached to a particular job or a particular way of doing. Well, let's not get into the thing whether it is right or wrong. That's not my point. The point is there is a stigma. So if the activity chosen is also seen as something big, or social acceptance and family acceptance. Oh, enga pasanga idu pannangala, If that is the kind of stuff, then it really is sustainable. Now, in my opinion, the thing which ticks all these boxes is typically anything related to craft. Because craft is something seen as something, great. It resonates with everybody in the society. And it also is a hands-on activity which helps them be, focused, therapeutic. It really helps them a lot. Like for example, maybe weaving or knitting or basket making, all these craft forms, they seem to fit the bill perfectly. Interestingly, craft also gives them an opportunity to have their own, me time. We all need a little me time, right? And it also connects with the society. After they do it, it connects with the society. That's a beautiful intersection, in my opinion. So now we say that, craft update, then how do we take it forward is the next question, right? And how do we create a work atmosphere? How do we do it? I'm not talking from the homelessness point of view, or I'm generally talking about people with mental health issues, including people with intellectual disabilities, disorders. So I think it's important we create some workspaces which are kind of nearer to their homes and places, a kind of decentralized thing, and then see a way of connecting them all in a larger umbrella. In my opinion, that's more sustainable because there are a lot of issues with commuting, who's going to be with them. There are a lot of issues, especially for adults. Honestly, we even now in cities we have schools and centers for people up to 18 years old. After that, what do they do? It's a big question. When they become adults after 18, which schools take them? There's no school for them. The only vocational centers there are also, in my opinion, very few. So there will be some necessity. So how do we make an occasion which is also scalable, which is also connecting everything? That is something we need to address. Then comes first is the workplace and then the tools. Again, as I draw from Sharada, that we need to adapt to their requirements, right? The tools play a major role. We cannot expect that they will have a professional quality tool which is used by an artisan in a craft. They can't use it. Even you and I cannot sit in a loom and weave. Impossible. Can we expect them to become Kanjipuram weavers tomorrow? That's not the point. So the point is, how do we make them do which is possible by them to do? So you make some tools which are adaptable. Then it becomes easy for them to do. Right? For example, some of the looms what we have for this, what we supply is basically we even have looms with wheelchair access. We have people even with cerebral palsy, wheelchair bound. They are also weaving today. So a lot of efforts are required by the design institutes, engineering institutes to bring in important tools to see how to make it adaptable for them rather than how to skill them for this. It's not going to happen. So that is some area where I think there is a lot of research and development is required as a country and society, in my opinion. And then the other area is important thing is process. See, again, to draw from Sharada, they are differently wired. We cannot try to put a square peg in a round hole, and we can't expect that. So how do we adapt the process for them? We can't have the same yardstick. Important thing in my opinion is, in a regular setup of production or vocation, it is output driven. Here it should be process driven. That's a fundamental difference. I think if we have it in mind, we can design the whole thing according to that. But even like in a process, fundamentally the idea is they should be mindful. It becomes therapeutic. It should be seen as something enjoyable. There should be a freedom for them. If you're going to be instructing, this is the only way to do it, then it becomes very restrictive for them. So interestingly, what we did as a company, as an organization in this sector is, we brought in the concept of something called freestyle weaving based on Japanese Zen philosophies. So the whole idea can change. Instead of making for example, in a traditional say, or a saree or dress, there are a lot of patterns, motifs, they repeat in a particular order to bring in a particular effect. it is very difficult for them to follow that. அவங்களால பண்ண முடியறது ரொம்ப கஷ்டம். So if you ask them to do some patterns and some, then it will lead to mistakes. Mistakes will lead to frustrations, and frustrations will lead to disinterest for them, and the whole thing is defeated. See, if you are able to make it, a little different thought process pannom appadina, that is, what we do is, we surround them with colors. Of course, they may not be able to, do a color combination on themselves, by themselves. But then, what if we as a design institute, or have some designers, what colors will work together, give them, surround them with colors, let them get have the freedom to do whatever they want. Interestingly, the output is like amazing. In fact, you can see some of the products being displayed by Mary here, right, outside. It's amazing. Like, I call them the, fabrics of joy and freedom. It's an original thought process what they come out with, and it's so creative, and every meter will be different. And very interesting observation what we also made in the process is, the people especially with autism or Downs or all this, they are not able to tolerate mistakes. So in the process, what happens is the fabric what they make is also zero defect, and it has got a different sensibility and beauty to itself. And then we take it and if we can be able to convert into products which are saleable, it has got a new meaning to the whole thing. So if you are able to do all this, I think if you are able to make it meaningful for them, and with a lot of social acceptance, and make the process and the tools adaptable to them, I think we can create a beautiful society for them. Thanks for the opportunity.
Thank you, Mr. Naresh. I think that was very comprehensive in terms of understanding that we need to be very mindful, and also not to be so restrictive about the kind of tools that we use in order to train people with variegated disabilities. Also to make it more user-centric, and also understand what their needs are, what their interests are. And it doesn't have to be therapeutic all the time, but they need to have the freedom and autonomy, at the same time enjoy the process of making a product. And he also emphasized on the role of social stigma. Thereby there's a lot of pressure from parents, from families, and from the community to make a very perfect product, which is not probably the process that we need to follow as far as persons with disabilities are concerned. Also to make products that are whatever is pragmatic and plausible is the message that we would like to take away from your speech, sir. Thank you so much. So we have both Mr. Naresh and Mr. Karthikeyan here. I think there are two special entities where they've dedicated their lives in terms of building the skill development unit for persons with variegated disabilities. I think very grateful for both of you, where both of you have taken this sort of a mission to kind of serve people with this kind of disabilities, and at the same time a lot of us are pressurized, where we also want to see outcomes in people with disabilities. But I think both of you have taken on a different mission, where you are also looking at process oriented, and also looking at how you can advocate for people in terms of looking at skill as a very important part of everyone's lives with disabilities, but at the same time taking on a different route where there's no pressure, at the same time looking at a user-centric paradigm, which is amazing, sir. So the next question to you is, what are the key reasons that you felt that Worth Trust as an organization, where its approach can be used to create healthy workplaces for marginalized populations, and also for people with different kinds of disabilities? So if you can shed light on that, sir.
Archana, good morning to you all. Good morning to the eight panelists. I think it's a pleasure to be amidst the veterans and the stalwarts in this area of mental wealth and health. Okay, I would say wealth first and I am a novice to start with in mental health. Let me start by admitting that, because I told you in the first interaction itself. We as an organization for past 60 years, we have been working in all forms of disabilities, but not exactly for mental health. So when Banyan invited me for this panel, I was finding myself out of place, okay? But then your question, well-directed question, made me more confident to be sitting amidst you. WordTrust is a different type of an organization. It's a unique model which combines rehabilitation with employment. And when Dr. Archana was summarizing Mr. Naresh's very thoughtful talk, the one thing you constantly referred is without any pressure and challenge. But unfortunately, WordTrust was in a situation in an environment of extreme high level of pressure also. Small correction. Because craft is something which is creative and it can be created by people with special abilities. I don't call them different labeled, I call them specially abled. But in our situation, we had to, over the past 60 years, as an organization, we have to, the adaptation is the right word. We have to adapt the industries, we have to adapt the machinery, we have to adapt the layouts, we have to adapt even the customers to our requirement. We started with around 20 people and today we are around 550 people strong in 6 to 7 locations. And the people who are originally starting with leprosy cured to polio cured to now hearing impaired to recently we have added spinal cord injured people also into employment. Okay, tying up with CMC's Mary Verghese Institute of Rehabilitation. So all these years, the main challenge, if it is, I don't know whether it can be a learning or it can be a lesson to others, because they all are stalwarts, as I said. Because mental health, when it comes to our employees, to keep them in the high level of morale for them to churn out quality products day in and day out, which is very much in high demand from the customers. Because customers who are the stalwarts in the industry today, they have their own pressure. They don't tolerate any bad quality or bad service. Okay, so we have to adapt to that type of a pressure situation. So primarily we need to have the state of mind and the mental well-being in the top notch for all the employees. That is being done by first converting the sympathy to empathy. See, we heard that empathy, I think right from Mr. Vijayakumar, they started talking about empathy. Nobody wants sympathy, especially people who are thrown up with challenges. They don't want sympathy at all. They want empathy for them, for us to adapt to their needs in terms of machinery and layout. Okay, we have to put ourselves in their shoes constantly to create layouts and remodify machinery as required. The second point is to replace self-pity with pride and sense of achievement. That Mr. Naresh talked about in weaving how the products are made more meaningful, the work is made more enjoyable to them. Here the work may not be as enjoyable, but you have to create an environment which gives them a sense of pride constantly, where they are acknowledged for their achievements, where we get the customers' feedback and customers' appreciation shared with them. And third thing that we have been practicing is involvement of employees, total employee involvement. That has been the recent mantra, that people are involved in all facets of business, right from planning to execution, right from the making the surplus for the revenue that is generated to spend for the expansion of the industries and expansion of the rehabilitation centers. Fourth most important thing is instilling the positivity in among the employees. That is changing the negative thoughts. With all that, we remove the self-pity, we make them feel important, we give them self-esteem, everything. Beyond that also, in all situations they cannot be positive. So we have to constantly drive positive thoughts in them. So we have chosen champions of positivity among various units to drive the movement of positivity among the employees and give them, share with them the success stories of others and things like that. So it's an ongoing process. Okay. When I say mental health, it is primarily for the employees that I am talking about. But recently we have also ventured into employing the mentally challenged, that is intellectually challenged children into things like horticulture and all. We have recently started ITA course under NCVT, National Council for Vocational Training, based with syllabus for horticulture, imparting it to all the people with intellectual challenges and the adults who are just in their late teens. So it's a 2-year course that they will go through, and they will be employable in various farms and various institutions, hospitals and educational institutions all around. So that's the way we have started creating some sort of meaningful livelihood opportunities for them. So we have touched the tip of the iceberg when we really address people with mental challenges. I think I look forward to this opportunity of meeting some great people here on the dais as well as among the audience to progress in this area. As I said, we are just starters in that, and this session has been a great learning experience personally for me. And thank you for the opportunity, Dr. Archana. Thank you.
Thank you, sir. So to summarize what Mr. Karthikeyan said, that I think even I've gone through this dilemma where I've been at both extremes, where I want to buy a product because I like it. Sometimes I want to buy a product because it's made by a certain group of vulnerable population. So sometimes all of us would have gone through this sort of a dilemma. So here Mr. Karthikeyan sir was talking about no pressure, but he said unfortunately there is pressure. So I think based on the category of disability that people belong to also, we can kind of adhere to curating those sort of workplace paradigms as well. It is indeed very difficult, sir, to work with disabilities, I mean beyond mental health, also with people who have spinal cord injuries, and also with intellectual disability, where you said that you've also introduced horticulture as a kind of vocational system for them, and also to look at a very conducive environment in terms of integrating aspects of empathy, integrating aspects of positively encouraging them all the time, because those small wins is what actually really matters than looking at the larger outcomes or in terms of looking at the quality of the product. In developing countries, about 80 to 90% of individuals with disabilities are unemployed between the age group of 20 to 40. Whereas in developed countries, it's about between 50% to 70%, whereas the age group is a lot more beyond 30 to 40 years of age. So which means early onset more in developing countries, also because probably they do not have access to basic amenities or access to health care or mental health care. Thereby, they have early onset of illness, and then the primal years of working or stabilizing the career is that opportunity is completely lost. Therefore, when we start rehabilitation around mid-40s or late 40s or early 50s, sometimes as much as we want to be quite positive, but also looking at it from a different lens, probably it's also too late in terms of stabilizing themselves, also in terms of incorporating yourself into the larger world. But beyond all that, I think as a panel we are here seated today only to look at what are the possibilities beyond all the impossibilities that are being posed in front of us. Moving on, I think we've spoken about the government policies, the role of the government. We've also spoken about people in terms of how they've taken on this sort of a mission to kind of develop the occasional integration as a huge sector itself. Moving on to education and training now. This question is for you, Dr. Damen Queen. How can social work education and training be enhanced to better equip future professionals to work with homeless people with mental health issues?
Very good morning to all present here. So when you look at the role of higher education in terms of addressing the issues of homelessness and especially special reference to mental health, so as an academic institution, we have got greater role to play in terms of addressing these mental health issues. Number one, what could be done by higher education as a social work institution also, we have got ethical obligation to respond to the crisis in the society. This we have observed post-COVID, the rise in mental health issues. So there is a dire need to offer courses. So that's the areas of expertise that lies in the higher education. So we do have social work has been a specialization for 60 plus years in India. So there's a dire need to have specializations in the area of mental health. So one of the role is to creating human resource in the area where they can address the mental health in the field. So academic curriculum, developing academic curriculum is one of the important aspects, because we have been seeing from each one of the panel, they have been sharing about a lot of evidence-based practices, some of the best practices models. You will get to hear when you've been part of the panel, or you can go to the website, or if you're part of the beneficiaries. Otherwise, where is the scope for that to be documented? So right, when you look at that, educational institutions like this has got a scope to update that to be part of the curriculum, and also disseminate this knowledge to the young professionals where they can take it, and because it's already proven method. So here is a scope for them. For us as academicians, we can include this part of the curriculum, and we can also train the young professionals who has got greater scope to work in the field. So academic curriculum development is one of the area that we can look at. And number 2 is training. Especially when you look at homelessness, the major challenge is the perspective change that lies in the society. So the moment when you think of homelessness, what is the biggest challenge that is attached is the economical issues. But as a social work, we need to look into the holistic of it. As a social work institution also, we look at the homelessness into the public health perspective. So developing a lot of perspectives, paradigms, we look into the intersectional of the problems, where the young professionals can be trained so that they can go back to the field and then implement whatever being learned. So that is another aspect, training. And number 3, in terms of mental health, we do understand this is an era of community-based rehabilitation. So we do have extensive research done in the area of institutional care, which has been really successful. But recently, in the last 2 decades, when you see that it's an era of community-based rehabilitation, especially in terms of rehabilitating and rescuing or repatriating the client, the family-based care and the community support is a very significant factor. So in terms of that, training the volunteers or training the people who are working in the mental health care, so that role is very, very significant. So community-based rehabilitation model, bringing it as part of the curriculum and also going. And number 5, when you look at that, is research. As you look at in terms of mental health or any social work, it is an evidence-based practices. Because we don't work, patients cannot be the guinea pig. Something has to be a proven model so that you can take and then that can be implemented. So evidence-based research are the biggest scope for higher education, where they cater to their needs. For example, when you look at the homelessness, the predominant society draws the opinion about mental health by looking at people who are homeless. So by looking at the community, individuals are the byproduct of the society. So the major section of the understanding, the perspective change has to be brought in. So this can be done through researches, updated things. So disseminating the researchers in a forum like that, and that will work out. And again about advancing cultural competencies, especially when you're working with homelessness. The definition is different from developed country to underdeveloped country and in developing country. So when you look at the homelessness, whereas in India is concerned, people who don't have a space to stay, all right, so we will call the people as homelessness. Whereas when you look at the developed nations, people who don't have job, so people who don't have financial security, where they have this homelessness card and where the nation takes care of it. So we need to have the lot of lobbying works, advocacy, to focus on what is homelessness. A lot of researches have to be done in, so that we will be, as a nation, we will have a lot of culturally developed models, so that the students or the young professionals will have cultural competencies to work in those areas. So as an education institute, we have got those roles to play. And when you look at the mental health as a bigger platform, the major challenges, majority of the section of the society, they are not aware about the mental health issues that they are undergoing. Even if some understand about the mental health issues, they are somewhere by the society or by their self or by the stigma exists in the society, they have problem in accessing the resources, or they don't want to go because they doesn't want themselves to be labeled. So here I really wanted to address about the stigma and the discrimination that exists in the community level. And if the major section of the society or few section of the society, they understand the mental health problems, if they know the where the support is, the number of mental health professionals are very less. So as an education institution, we address this gap of producing the human resource in the area of mental health so that they address it, so that the gap can be addressed to the little extent, so that we will have adequate professionals who are getting these exposure. And again, when you look at in the specialization of mental health, so much of literatures in the existing profession focuses on illness paradigm. Some of them was focusing about pathogenesis, what is the symptoms that are associated with it. I think there is a paucity of literature in terms of saltogenic factor, which is the driving force behind the wellness paradigm. So the saltogenesis is something that, beyond the illness, what is that resilient factor? So most of my articles will focus on saltogenesis. I think as a social work also, we are moving in from problem solving approach into a strength based approach, which is working out really well, because when you look at the patients or the caregivers become the secondary patients. And researchers tell that, if the mental health of the secondary patients or mental health of the caregivers is sound, it has an important indicator in having an impact on the patients. So these kind of the researchers can be collaborated with the field expert. When we talk about the field, so these are the people having expertise in the field. So we have the resources. So these knowledges can be taken, converted into a research, and these can be, disseminated. So in terms of training the professionals, developing a curriculum, and then also in social work, we have got a greater exposure to work in the communities. In terms of communities, sensitizing the community about the need for looking at the mental health issues and the homelessness, creating awareness, and beyond that having a health education programs, so that the community will also be prepared to look at the need of mental health and also addressing. So looking at the holistic approach of it, the academic institutions' roles could be this.
Thank you, ma'am. So what ma'am was focusing a lot more on in terms of the paucity, in terms of community-based rehabilitation. There's a lot of evidence-based practice as far as hospital care is concerned, in terms of access care points that have been created and how those models have worked. But there's a lot of gaps in terms of understanding how these evidence-based practices can be converted in terms of looking at adding into the curriculum, where a lot more human service professionals can be trained to understand people with disabilities, so that they can probably have an impact in terms of developing a vocational training curriculum, or looking at how you can also understand the intersectionality between homelessness, poverty, and other associated factors, because those are the factors that probably play a much more dominant role than looking at the individual with a lot more deficit. Thank you, ma'am, for that knowledge. We move on to Mr. Shibu Albert. Considering that you have voracious experience in terms of looking at skill development, also with diverse groups, what are the key challenges in providing long-term employment solutions, and how can organizations collaborate to overcome them?
Good morning all, and very happy to be in this dais with all of you. I think the challenges I need not say, because most of you have already described the challenges, because in every speech I could see that the challenges have been described. But these challenges I would like to classify into three. One is the self-related challenges faced by the people with mental illness. So their lack of motivation in life is a first thing that because already the challenges what is already described, I'm not going to repeat it again. Then second thing is not ready to work. And third is I think hesitant to reach out when they need support. then this the most important thing is that there is no say sense of purpose and belongings. So these are the challenges I would add on it, apart from what we have discussed. The second challenges is the societal challenges, which we have already discussed, as the main important thing is the stigma. So when we say mental illness, they feel that they are not fit for work, unfit for work. Then second, most of the employers are not ready to provide or job opportunities for people with psychosocial disabilities. And even if they provide opportunities, there is a discrimination. So in terms of salary or in terms of the job, the kind of job that they give. And we also experienced in some places that they are ready to give opportunity, but not in terms of job, but as a charity. So that also is making the clients, the motivation is going down. Then third, I would say how it is hitting back to them, because we prepare them skill and they are trained. When they go to the society, when they go to the job, the societal the challenges hit back to them because of the discrimination. Again, their motivation and sense of purpose goes down. So these are the thing I think classification, which all of us what we have said, these are the three classification I could see. Then what are how we can overcome? Some of the recommendations I would add some of my experience when I was working with the Tata Institute of Social Sciences. I had a chance to head the School of Vocational Education. So we created a model called Work Integrated Training Model. It's a collaborative model between the industries and the university. We set up a lab, training section and lab in the industry, and we gave an opportunity for students to learn there. It kind of on-the-job training. So there they could learn from doing their work. So theoretical approach was second, and first we asked them to work on the shop floor, and then the theory is applied. Then I also had a chance to work in labor market research facilities, where we worked with the laborers, mostly in Mumbai. Mostly it was the migrant laborers. So unskilled to skilled, and unskilled to semi-skilled, then semi-skilled to skilled, and skilled to upskilled. So why these short forms? Because they are not ready for a long-term training process, because they are already working and having a livelihood. So what we did, we gave incentives. So from unskilled to semi-skilled, we gave incentives that motivated them to come and attend the training. Then semi-skilled to skilled, we gave them tools so that they can go and work. And then upskilling, we give modern machineries. So this all happened with the help of philanthropists. So then we have developed one model. Then we as a team, we discussed as professors and other team members, we discussed, we are only addressing the surface level. What is the root cause? Where is the root cause? So we could see that we have to start from the schools. So we developed a model called BEST, Basic Education and Skill and Technology, where it is a 3 years program. So we introduced multiple skills in a lab, where students can come and experience all the skills. So it is carpentry, plumbing, environment, health, then multiple energy, multiple levels of skill sets we have introduced. It's almost 10 skills. Then students have to compulsory undergo all these trainings. So there is no compulsion. We made it very clear that there is no examination. So fear of examination will make them to run away from all these additional learnings. So we made them to be in the lab for 1 year. I mean, we were keeping observing. So they were making lot of experiments in carpentry, plumbing, and electrical, electronics. So we could observe that students are keen to particular areas, they are constantly going and doing particular kind of skill sets. So we could understand that they are interested in that area. In the second year, we narrow down to 5 and selecting the interested area, and we give them the special training on 5 areas. And in the third year, we selected only 2 and we gave them certificate, and which will help them to choose their higher studies even, because it is not to make somebody carpenter or plumbing, because this is I think this is a essential skills that we also need to know, because if a switch goes wrong and we call for a electrician, if you know the basic electricals, we can operate it and correct it, because we don't do that. So that was a successful model, and it is done in a rural village in Bombay, and it is in a tribal school. So the students were available all the time there. So they were free to access the lab, and the trainer were also available. So taking that experience, we applied to some of the people with mental illness. So we have given them specific training. So some of them have picked up, and they started their own ventures. So one started the two-wheeler mechanical shop, and one has started jasmine plantations, and they started earning. Then one became a Warli painter. So there are a lot of developments we could see in that area. So drawing again a clue from all this experience, in the Banyan, we started a new concept called skill lab, where, because I am also agreeing with all of you who have said, they should like it. So we have to understand what they like. So we are in the process of setting up a skill lab, where multiple employable skills will be showcased, where they will get a chance to go through all these multiple employable skills, and we will observe them, and to understand their interest and their the skill sets. So based on that, we can give additional training. And in fact, there are a lot of institutions are there to support in a certification as well. So these are the things that we are going to try. And also we could see where we start. It's not that straight away we can start them for employability training. First we have to motivate them to have a sense of purpose. Then independent living, such kind of motivation need to be given. Then they are not ready. So giving lot of soft skill to face the society. Once these things are done, then we can take them to the employable training. Then most important, after giving the training, where they go is a question, because most of the employers are not ready to accept, but examples are here. So you people are already here and providing employment opportunities. So sensitizing the employer is most important. And so we have to give them, as an organization, we have to give them a confidence that if something happens, we are there to support. So all this, if these things can be worked out, I think there is a larger scope for making them long-term employment opportunities. Thank you.
Thank you, Mr. Shibu. I think it was very comprehensive in terms of for us to understand different models as well, as far as occasional training goes, to understand individual level challenges as well as factors, also to look at systemic level challenges as well as factors that probably come in terms of obstacles in the way of people getting trained. And also we got exposed to new models that you're probably highlighting on in terms of work integrating model, the best model again, and also looking at soft skill as a key training tool as well. So the process is also important, what we do in terms of understanding the purpose behind the whole training venture, and at the same time also to understand how do we keep them motivating and also have a conducive environment. Thank you for that from your experience from Tata Institute of Social Sciences. Next we move on to Ms. Premavathy. So Ms. Premavathy is working as a pharmacist at VSR Hospital. So what types of support systems were most beneficial in your journey towards mental health recovery, and why is work important to you?
நான் வந்துட்டு இப்போ தமிழில் பேசலாம்னு நினைக்கிறேன். ஏன்னா எனக்கும் அதான் கன்வீனியன்ட்டாக இருக்குது, ப்ளஸ் உங்களுக்கு கன்வீனியன்ட் ஆகும்னு நினைக்கிறேன். இப்போது மென்டல் ஹெல்த் ப்ரோக்ராம் நம்ம எதுக்காக பண்ணுறோன்னா, எஸ்பெஷலாக மென்டல் ஹெல்த்து இல்லாதவங்க மென்டல் ஹெல்த்தை இம்ப்ரூவ் பண்ண டேவை நம்ம செலிப்ரேட் பண்ணுறோம். அதுதான் நம்ம மென்டல் ஹெல்த் ப்ரோக்ராம் வந்து இயர்லி. நம்ம பர்த்டே எதுக்கு செலிப்ரேட் பண்ணுறோம்? ஐ மீன் இயர் பை இயர் நம்ம வந்துட்டு நம்ம என்ன சக்ஸஸ் பண்ணோன்றதை நம்ம ஒரு வருஷமும் நம்ம செலிப்ரேட் பண்ணுறோம் நம்ம பர்த்டே. ஸோ இந்த வருஷத்துலேருந்து போன வருஷம் நான் இந்த வருஷம் நான் இருக்கிறேன், போன வருஷம் நான் கடந்து இந்த வருஷத்துக்கு வந்திருக்கேன், ஸோ ஐ அச்சீவ்டு திஸ் திங் அப்படின்னு தான் நம்ம செலிப்ரேட் பண்ணுறோம். அதே மாதிரி மென்டல் ஹெல்த் டேவும் நம்ம செலிப்ரேட் பண்ணுறதுக்கு என்ன இதுன்னு சொன்னால், வருஷம் நம்ம இம்ப்ரூவ் ஆகிட்டே வரும். அதனால தான் நம்ம மென்டல் ஹெல்த் டே வந்து நம்மள மாதிரி பின்னாடி வரவங்களுக்கும் ஐ மீன் இப்போ நம்ம இம்ப்ரூவ் ஆகிருக்கோம், முன்னாடி இருந்து இப்போ இம்ப்ரூவ் ஆகிருக்கும், அதை செலிப்ரேட் பண்ணுறதுக்காக தான் இந்த மென்டல் ஹெல்த் டே. ஸோ இதில் நம்ம ப்ராப்ளம்ஸ் எல்லாம் சால்வ் பண்ணி எப்படி இதை செலிப்ரேட் பண்ணுறோம் அப்படின்றது நான் என்னோட ஒரு கருத்து. இதில் என்னென்னா, இங்கே எல்லாரும் இருக்கோம், ஐ மீன் இங்கே விங்கில் இருக்கிறவங்க எல்லாமே வந்து நமக்கு சப்போர்ட் பண்ணுறாங்க. ஆஸ் வெல் அஸ் இது நீங்கள் பார்த்துட்ருக்கீங்க, நீங்கள் இதில் ஸ்டூடெண்ட்ஸ் இருக்கீங்க, அதே மாதிரி இது மனநலம் பிரச்சனை இருக்கிறோம் எல்லாமே. நானும் மனநல பிரச்சனையில் இருந்து இப்போ மீண்டு வந்திருக்கேன். ஸோ இந்த மனநல பிரச்சனையில் இதில் பேசிக்காக என்னென்னு பார்க்க போனால், நம்ம என்ன நம்மளுக்கு பேசிக் என்ன, நம்மளுக்கு தாய் மொழி தமிழ், தாய் நம்மளுக்கு முக்கியம், அடுத்து தகப்பன், அதுக்கப்புறம் கூட பிறந்த சகோதரர்கள், நம்ம ஃபேமிலி. ஸோ இவங்க தான் நம்மளுக்கு பேசிக், இதுதான் நம்மளோட அடையாளம் இல்லையா? அப்போது நம்ம எதனால் ஃபஸ்ட்டு நமக்கு தேவையானது நம்மளுடைய ஃபேமிலி. ஸோ அந்த ஃபேமிலி நம்மளுக்கு சப்போர்ட் பண்ணணும். அப்போ தான் நம்ம வந்து ஃபஸ்ட்டு நம்மளோட மென்டல் ஹெல்த்து நம்மளுக்கு நல்லா இருக்கும். ஸோ அந்த ஃபேமிலி சப்போர்ட் பண்ணணுன்னா நமக்கு ஹோமு ஃபேமிலி அவங்களோட சப்போர்ட் இல்லாத பட்சத்தில் ஆல்வேஸ் நம்ம நீடு இருக்குது. ஆனால் அவங்களோட சப்போர்ட் ப்ளஸ் அவங்களோட சப்போர்ட்டு, சொசைட்டியோட சப்போர்ட்டு, இதெல்லாம் இருந்தோன்னா நம்மளுக்கு மென்டல் ஹெல்த்து அஃபெக்ட் ஆகாமல் இருக்கும். ஸோ அது ஆஸ் வெல் அஸ் நம்மளுக்கு மெடிக்கல் சப்போர்ட் இது மாதிரி இருக்கணும். ஸோ இந்த மாதிரி இருக்கும்போது நமக்கு பேசிக்கு என்ன இருக்குது, ஹோமு, ஷெல்டரு, ஃபுட்டு. இது ஒரு ஹியூமனுக்கு மென்டல் ஹெல்த் அஃபெக்டட் பர்சனாக இருந்தாலும் சரி, அஃபெக்டட் இல்லாத பர்சனாகவும் சரி, எல்லாருக்கும் வந்துட்டு பேசிக் நீட்ஸுன்றது அவசியம். இது வேர்ல்டு ஃபுல்லாகும் இது பொருந்தும், நாட் ஒன்லி சிங்கிள் பர்சன். இது வந்து வேர்ல்டு இருக்கிற எல்லா பர்சன் ஹியூமன் பீயிங்க்கும் ஃபுட்டு, ஷெல்டரு, வாட்டருன்றது பொருந்தும். ஸோ இப்படி கிடைக்காத பட்சத்தில் ஒரு மனுஷங்க மனநலமும் பாதிக்கப்பட்டிருந்தாங்கன்னா அவங்களுக்கு ரொம்ப கஷ்டம். ஸோ அப்படி இருக்கிற பட்சத்தில் இந்த மாதிரி பீப்புள்ஸ் இருக்கிறதுனால தான் நம்ம மனநலத்திலேருந்து மீண்டு வர்றதுக்கு உதவியாக இருக்குது. அது மேபி whoever may be the supporting persons. பட் இப்போது நான் வந்து எனக்கு எல்லாம் கிடச்சிட்டு இருக்கிறது பேனியன் மூலமாக. ஸோ அதுக்கு அவங்களுக்கு நான் என்னோட முதற்கண் நன்றியை தெரிவிச்சுக்கிறேன். ப்ளஸ் வந்து ஃபுட் ஷெல்டர் வாட்டரை தவிர நமக்கு மென்டல் ஹெல்த் பாதிக்கப்பட்டிருக்கிறதுனால மெடிசின்ஸ் தேவைப்படுது. ஸோ மெடிசின்ஸ் தவறிட்டோன்னா, ஃபார் எக்ஸாம்பிள் நாட் ஓன்லி இன் மென்டல் ஹெல்த், மற்ற ஹெல்த் பர்சன்ஸ், ஐ மீன் ஃபார் எக்ஸாம்பிள் இப்போ மென்டல் இல்னஸ் இல்லாமல் மற்ற பீப்புளும் இருக்கிறாங்க. எப்படி சொல்லலாம், உங்களுக்கு புரிகிற மாதிரி சிம்பிளாக சொல்கிறேன். ஒரு டயபட்டாலஜி பேஷண்ட்டு, ஒரு பிபி பேஷண்ட், அவங்களாம் மெடிசன்ஸ் எடுக்கலைன்னா எப்படி ப்ராப்ளம்ஸ் வரும். அதே மாதிரி மென்டல் இல்னஸ் இருக்கிற பீப்புள்ஸ்க்கும் மெடிசன்ஸ் தேவைப்படுது. ஸோ அவங்களும் அஃபோர்ட் பண்ண முடியாத நிலைமை தான் இருக்கிறாங்க. இருக்கிற அஃபோர்டபுள் பீப்புள் கேன் கோ அண்ட் பை சம் மெடிக்கல் ஷாப் அண்ட் தே கேன் கன்சியூம். அதர்வைஸ் இல்லாத பீப்புளுக்கு மெடிசின்ஸ் இலவசமாக நமக்கு கிடைக்கிறதுக்கு குவாலிட்டி மெடிசின்ஸ் அஃபோர்ட் கிடைக்கிது. ஸோ மெடிசின்ஸும் கிடைக்கணும். அதுவும் பீரியாடிக்கல் செக்கப், டாக்டர் செக்கப் வேணும், அது நமக்கு இங்கே கிடைக்கிது. ஸோ அது சாதாரண பர்சன்ஸ் இல்லை, ஸ்பெஷலி சைக்காட்ரிக் பர்சன்ஸ், சைக்காலஜி ஸ்பெஷலிஸ்ட்டு டாக்டர்ஸு இங்கே 24 hours அவைலபிலிட்டி இருக்குது. அவங்க வந்துட்டு கேர் எடுத்து ஒரு ஒரு எப்படி சொல்கிறது, சரி வாங்க என்ன பண்ணுது அப்படி கேட்டுட்டு போகாமல் சொல்லுங்கன்னு சொல்லி உட்கார சொல்லி டைம் ஸ்பெண்ட் பண்ணி அவங்களோட ஹிஸ்ட்ரிஸ் கேட்டு மந்த்லி வைஸு பீரியாடிக்கல் செக்கப் கொடுத்து ஜென்ரல் ஃபிசிஷியன்ஸ் அவைலபிலிட்டி கொடுத்து ஃபிசிக்கல் ஹெல்த் அண்ட் மென்டல் ஹெல்த்து கிடைச்சிருக்கு. ஸோ இதனால் ஃபிசிக்கல் ஹெல்த்து மாத்திரம் மென்டல் ஹெல்த்து மாத்திரம் முக்கியம் இல்லை, ஆஸ் வெல் அஸ் ஃபிசிக்கல் ஹெல்த்து ரொம்ப முக்கியம். ஃபிசிக்கல் ஹெல்த்து நல்லா இருந்தால் தான் மென்டல் ஹெல்த்து நல்லா இருக்கும், மென்டல் ஹெல்த்து நல்லா இருந்தால் தான் ஃபிசிக்கல் ஹெல்த்து ஒன்றா இருக்கும். ரெண்டும் கோரிலேட்டடாக போகணும். நீங்கள் வந்து ஃபிசிக்கலாக ஹெல்த்தாக இருந்துட்டு மென்டலி ஹெல்த் இல்லைன்னு சொன்னால் முடியுமா? உங்களால் எதாவது சாதிக்க முடியுமா? முடியாது. அதே நேரத்தில் ஃபிசிக்கல் ஃபிட்டாக இருந்துட்டு மென்டல் ஃபிட், ஸோ புரிஞ்சிச்சு நினைக்கிறேன். ரெண்டுமே வந்துட்டு கோரிலேட்டடாக இருக்கணும். ஸோ இது வந்துட்டு முக்கியம், அதுக்கு மெடிசன்ஸ் முக்கியம். தென் நெக்ஸ்ட்டு வந்துட்டு இப்போது நமக்கு ஃபுட்டு ஷெல்டர் கிடச்சிச்சு, மெடிசன்ஸ் கிடச்சிச்சு, வேறு என்ன கிடைக்கல, நமக்கு ஃபேமிலி செட்டப் இல்லை. ஃபேமிலி செட்டப்புக்கு என்ன பண்ண முடியும்? வெறும் சாப்பிட்டுட்டு மெடிசன் சாப்பிட்டுட்டு அப்படியே பொம்மை மாதிரி உட்காந்துட்டு இருக்க முடியுமா? ஃபேமிலி செட்டப் எதுக்காக நம்ம ஃபேமிலி செட்டப் கேட்குறோம்? ஃபாதர் மதர் நம்மளை வந்துட்டு இது பண்ணுறதில்ல. ஸோ நமக்கு ஃபாதர் மதராக யாராவது ஒருத்தவங்க நமக்கு கேர் பண்ண மாட்டாங்களா? நம்மளை நமக்கு லவ் அண்ட் அஃபெக்ஷன் கொடுக்க மாட்டாங்களான்னு போது அந்த லவ் அண்ட் அஃபெக்ஷன்ஸு நமக்கு இங்கே கிடைக்கிது. ஸோ அதெல்லாம் கிடைச்சதுனால நமக்கு நெக்ஸ்ட்டு வந்து ஒரு இதெல்லாம் நமக்கு பேசுகிறதுக்கு சொல்கிறதுக்கு ஒரு புத்தி எதுக்கு நமக்குன்னா ஒரு குவாலிஃபிகேட் பர்சனாக இருக்கிறதுனால எனக்கு இந்த சொல்கிறதுக்கு ஒரு புத்தி கொடுத்துருக்காங்க. அந்த குவாலிஃபிகேஷன்ஸை நமக்கு கண்டிப்பாக வேணும். ஆஸ் அ லேடி, ஐ மீன் ஆஸ் அ உமனாக ஒருத்தவங்களுக்கும் ஒரு படிப்பு ரொம்ப முக்கியம். ஏன்னா ஒரு படிச்சிருந்தோன்னா நம்மளுக்கு வந்து சொசைட்டியில் ஒரு வேலை செய்யலாம், நம்மளால் முடிஞ்ச ஏதாவது ஒன்று செய்யலாம். இப்போ நான் ஒரு ஃபார்மசின்னு ஒரு படிச்சிருக்கேன். இப்போ இந்த ஃபார்மசி நான் படிக்கிறதுக்கு எனக்கு புத்தியெல்லாம் கொடுத்தது என்னன்னு சொன்னால் எங்கள் அப்பா ஒரு இதே மாதிரி ஒரு பேஷண்ட்டு. ஸோ அதனால் எங்கள் அப்பா அஃபெக்ட் ஆனதுனால நான் எங்கள் அப்பாவுக்காக தான் இந்த கோர்ஸ் எடுத்து படித்தேன். நம்ம ஒரு மெடிக்கல் ஷாப்பை வச்சு எங்கள் அப்பாவோட இருந்து அவரை வச்சு நம்ம இது பண்ணிக்கலாம் அப்படின்னு சொல்லிட்டு அவரை இது பண்ணலான்னு சொல்லி தான் இந்த ஃபார்மசி கோர்ஸ் எடுத்து நான் படித்தேன். ஸோ இப்போ இன்றைக்கி எங்கள் அப்பாவை என்னால் வந்து சப்போர்ட் பண்ண முடியல, பிகாஸ் அவர் இப்போ இல்லை. ஈவன் தோ ஐ மீன் எனக்கு நான் ஈவன் தோ எனக்கும் நான் சர்வை பண்ணிவிட்டு மற்றவங்களுக்கும் என் ஃபேமிலி மெம்பர்ஸ் ஏதோ என்னால் முடிஞ்ச சின்ன ஹெல்ப் பண்ணிவிட்டு மற்றவங்களுக்கும் ஏதோ சின்ன ஹெல்ப் பண்ணுறதுக்கு எனக்கு இந்த எஜுகேஷன் ஹெல்ப்ஃபுல்லாக இருக்குது. ஆஸ் வெல் அஸ் எனக்கு இந்த ப்ரொஃபஷன் வந்து ஒரு மெடிசன்ஸ் கொடுக்கும்போது மற்றவங்களுக்கு கொடுக்கும்போது கவுன்சிலிங் பண்ணி இப்படி எடுத்துக்கோங்க, இந்த மெடிசன்ஸ் இப்படி எடுக்கும்போது இந்த சைட் எஃபெக்ட்ஸ் இருக்கும், அப்படி சின்ன சின்ன ஒரு விஷயங்கள் மற்றவங்களுக்கு சொல்லும்போது எனக்கு அதில் ஒரு சாட்டிஸ்ஃபேக்ஷன்ஸ் கிடைக்கிது. ஆஸ் வெல் அஸ் மற்ற மென்டல் சைக்காட்ரிக் பேஷண்ட்ஸ் யாராவது வரும்போது இப்போ நான் இந்த ப்ராப்ளம்லாம் இருந்தேன், உங்களுக்கு இந்த மாதிரி ப்ராப்ளம்லாம் இருந்ததுன்னா இந்த மாதிரி பண்ணலான்னு சொல்லி ஒரு கைட்லைன்ஸ் கொடுக்கறதுக்கு எனக்கு இந்த குவாலிஃபிகேஷன்ஸ் ஹெல்ப்ஃபுல்லாக இருந்தது. ஸோ இந்த லெவலுக்கு நான் வந்ததுக்கு அதே மாதிரி ஒர்க் பிளேசஸ்லேயும் எனக்கு எஃபிஷியன்ஸாக ஒர்க் பண்ண முடியுது. முன்ன காட்டிலும் இப்போது நிறைய ப்ராப்ளம்ஸ்லேருந்து நான் சால்வ் பண்ணி எனக்கு நான் இதுலேருந்து வெளியில் வந்திருக்கேன். ஸோ ஐ வெரி ப்ரவுட் ஆஃப் யூ டு சே மென்டல் ஹெல்த் ப்ரோக்ராம்ன்றது வந்துட்டு மென்டல் ஹெல்த்தை வந்துட்டு இனிமேல் இம்ப்ரூவ் பண்ணிகிட்டே இருக்கணும். ஏன்னா வேர்ல்டில் வந்து புதுசாக வந்துட்டு மென்டல் ஐ மீன் சைக்காட்ரிக் ப்ராப்ளம்ஸ் இன்க்ரீஸ் ஆகிட்டே இருக்குது. ஸோ அதுக்கு நீங்கள்லாம் முன்னே வந்து உங்களை மாதிரி வந்துட்டு ஒரு யங்ஸ்டர்ஸு நாளைக்கு நிறைய இந்த மாதிரி பிரச்சனைலாம் வரும்போது நீங்கள்லாம் ஒரு ஐ மீன் நம்மளோட வேர்ல்டில் வந்துட்டு இந்த மாதிரி ப்ராப்ளம்ஸு நீங்கள்லாம் வந்துட்டு ஒரு எப்படி நீங்கள் இப்படி பேனியன் ஒரு நிறுவனம் தாங்கிறதுக்கு முன் வந்திருக்கிறோம். அந்த மாதிரி நீங்களாம் ஒருத்தர் இவங்க ஒரு பேனியன்றது ஒரு வேர்ல்டில் ஒரு இது நிறுவனம். அதே மாதிரி நீங்கள் ஒருத்தரும் உங்களால் முடிஞ்ச ஒரு ஹெல்ப்பு இந்த மாதிரி சைக்காட்ரிக் பேஷண்ட்ஸ்க்கு நீங்கள் ஒருத்தர் சிங்கிள் என்ன உங்களால் என்னென்ன முடியுமோ அந்த மாதிரி செய்யுங்க. இவங்க ஒரு சின்னதாக ஸ்டார்ட் பண்ணாங்க, இதோ இன்றைக்கி பேனியன். ஸோ அதை வந்து ஒரு ஆலமரம் அது அவங்களோட இது. அது மாதிரி நீங்கள் ஒரு ஆலமரமாக இருந்தாலும் நீங்கள் ஒரு அரச மரமாக இருக்கலாம். அவ்வளோதான். தேங்க்யூ ஸோ மச்.
Thank you, Prema. I think you are bang on, I think. நீங்கள் வேர்ல்ட் ஹெல்த் ஆர்கனைசேஷன் என்ன சொல்லுதோ இல்லை நீங்கள் சொன்ன ஃபேக்டர்ஸ் எல்லாமே நம்ம சஸ்டைனபிள் டெவலப்மெண்ட் கோல்ஸோடு சார்ந்து பேசுனீங்க. அது தெரிஞ்சு பேசுனீங்களா தெரியாமல் பேசுனதில்ல, பட் ஐ திங்க் அது ரொம்ப இம்பார்ட்டண்ட். இப்போ இருக்கிற காலத்தில் வந்துட்டு நம்மளுக்கு ஐ திங்க் நீங்கள் பியூட்டிஃபுல்லாக அது ஒரு லீனியர் அப்ரோச் மாதிரி கொடுத்தீங்க. ஃபார் எக்ஸாம்பிள் ஃபஸ்ட்டு வந்துட்டு ஆக்சஸ் டு பேசிக் அம்யூனிட்டிஸ் இருக்கணும். ஸோ இன் டேர்ம்ஸ் ஆஃப் ஃபுட் இருக்கும், க்ளோதிங் இருக்கணும், ஷெல்டர் இருக்கணும் அப்படின்னு சொன்னீங்க. அதுக்கப்புறம் ஆக்சஸ் டு ஹெல்த் கேர் இருக்கணும்னு சொன்னீங்க. அண்ட் யூ ஆல்சோ செட் தட் நம்ம இன்டிகிரேட் பண்ணணும். வெறும் மென்டல் ஹெல்த்து ஜென்ரல் ஹெல்த்து பிரித்து பார்க்காம ரெண்டுத்தையும் சேர்த்து பார்க்குறது ரொம்ப இம்பார்ட்டண்ட் அப்படின்னு சொல்லியிருந்தீங்க. தேர்ட் வந்து ஆக்சஸ் டு எஜுகேஷன். ஸோ உங்களுக்கு எஜுகேஷன் உங்களால் ஆக்சஸ் பண்ண முடிஞ்சதுனால இவ்வளோ தூரத்துக்கு உங்களால் முன் வர முடிஞ்சது அப்படின்னு. ஐ திங்க் more than any organization or a contribution or more than whatever it is the universe has contributed, I think இதுக்கு உங்களோட வளர்ச்சிக்கு பின்னாடி நீங்கள் இருக்கீங்கன்றது ரொம்ப எவிடெண்ட்டாக தெரியுது. ஸோ வெரி கிரேட்ஃபுல் for you to share your journey here. I think it's not so easy to share one's lived experience, but அது நீங்கள் தைரியமாக எங்கள் எல்லாரோடையும் நம்பி பகிர்ந்துக்கினதுக்காக ரொம்ப நன்றி. So we are coming to a close to this panel discussion. Thank you for all your patience. To wrap it up, we've looked at the role of government and looked at the advocacy campaigns the government has proposed at the systemic level. We also looked at how we understood that early identification and the role of students and youth is a key factor that will lead to a larger program. We also looked at how we can use individual differences in a different way rather than labeling them and stigmatizing them, but rather if we can put that together and understand people better, that's a theory assumption that we can bank on. We also understood about the role of human service professionals, so where we have a lot of evidence-based practice and research as well, but probably there's a greater paucity in terms of understanding the role of vocational training and how skill development can be used as an important ingredient for one's mental health recovery. At the same time, we also got exposed to newer models in terms of vocational training as WIP, and then you have the BEST model, and also looked at how important, I think more than all of us, what is important for us to hear is from a mental health service user in terms of how a person can grow beyond all the obstacles that are being posed to this individual, and most importantly how these basics need to be met. I think that's a very key message that we need to take away as far as today's program is concerned, because one is about creating a curriculum, creating a system, creating a department that can probably relate itself and resonate itself in terms of the need of the hour. But if you don't have these basics, which is what we probably take for granted all the time, that we have access to food, access to people who also gives us that sort of sense of belonging, we also have a roof over us, we also have the sort of support systems, probably they are also very invisible, which is why we conveniently take them for granted. So the key takeaway for today is to put all these perspectives in place. Also as students, for you it's very important that you're able to see the intersectoral linkage between different departments and different disciplines that people come from, thereby in terms of it will help you in terms of your training, in terms of your transitioning from a student to a practitioner or from a student to a researcher. Thank you very much. We can take about 3 to 4 questions from the audience. If you have any questions to any of the panelists on the stage, please do ask. Please keep your questions brief as we are running out of time.
Hello. Yeah. So thank you to Banyan and MSSW for this phenomenal experience. This panel in a way represents the microcosm of society. Government, education, then we also have the polis. Now my question is, many of you refer to people as them, and I'm going to assume that it is people with mental illness, right? So my question is, if Alan Turing he is a mathematician who committed suicide. You have Elon Musk who has bipolar and is a scientist and entrepreneur. And Demi Lovato, many of you might know, she has bipolar as well. What is the difference between them and these people? And second question is, how do you believe these individuals should be positioned alongside them and society?
So this question is for whom?
See, very interesting question. Within the mental health, among the community of people who have this bipolar problem, most of the successful people in the world have the bipolar disorder. When they are at a very high excited state, they think they can assume and they can achieve anything, and no one can parallel their self-confidence and the kind of thought process they go through. But the mental health comes in to bring that thought process into control, to make them look like a normal person, think like a normal person. That's a kind of higher order thinking that enables them achieve great things. World's greatest scientists also have a bipolar disorder. Some are detected, some undetected, some confessed, some unconfessed, because of again the stigma issues. Maybe they can even be thrown out of their scientific community if it is told that they are a mental health person. And whereas the other side of the bipolar problem, having a highly depressed state, that makes them suffer a lot. And we don't know what kind of a state these people are in, but at the same time, if they are not supported by, like as Premavathy told, either a family support or a community support, or from the government agencies or from the social organizations, they need some support so that they are taken care and their issue is recognized, diagnosed and appropriately treated. Then there is no difference between a patient receiving care under mental health programs and a person receiving no care. That's the only difference. Once you identify and give them appropriate care, they are like any other person. There is nothing to differentiate them and others. We should not get confused between mentally health or mentally ill people and mentally challenged people. There's a difference. So if we appreciate that, then we will understand these people's success in that context. Thank you.
சாதாரணமாக நம்ம மனநலம் பாதித்தவங்களை வேலை செய்கிற இடத்துல எப்படி அவங்கள ஒருங்கிணைக்கலான்னு நம்ம யோசிக்கிறோம். ஆனால் இன்றைக்கி வேலை செய்கிற இடமே மனநோயை உருவாக்குறதோ இல்லை ஸ்ட்ரெஸ்ஸை உருவாக்குற மாதிரி சுச்சுவேஷன் நம்ம பார்த்துட்ருக்கோம். ஸோ அதை பற்றி கொஞ்சம் நீங்கள் பேசுனீங்கன்னா நல்லாயிருக்கும்னு நினச்சேன். ஸோ அதை எப்படி நம்ம மேனேஜ் பண்ணலாம் அப்படின்னு.
சார் உங்கள் பேர்? சாரி, ரவி. ஓகே, பேனியன். ஐ மெட் யூ ஃபர்ஸ்ட். இப்போ நான் சொன்ன ஒரு 3-4 கருத்துக்கள் உங்களுக்கு ஓரளவுக்கு அப்பீலிங்காக இருந்திருக்கும்னு நினைக்கிறேன். ஏன்னா இங்கே மேக்ஸிமம் டிசபிலிட்டி, மேக்ஸிமம் ஃபார்ம்ஸ் ஆஃப் டிசபிலிட்டி இருக்கக்கூடிய ஒரு செட்டப் எங்களுது. ஏன்னா ஒரு 7-8 பிஸ்னஸ் யூனிட்ஸ், 7-8 மேனுஃபேக்சரிங் யூனிட்ஸ், அட்வான்ஸ்டு மிஷினரி எல்லாம் ஆட்டோமேட்டட் மிஷின்ஸும் ஒர்க் பண்ணுற இடத்துல உங்களுக்கு நீங்கள் மென்டல் இல்னஸ் மட்டும்தான் பற்றி கேட்குறீங்க அப்படின்னு நினைக்கிறேன். அதுலேயும் we have tried people with some low there is who are mild challenged, mild intellectually challenged. இவங்களை நம்ம குவாலிட்டி செக்கிங்லேயோ இல்லை ஒரு அசம்பிளி ஏரியாலேயோ அவங்கள இது பார்த்தா ஆட்டிசம் இருக்கிறவங்க கூட ரெப்பிட்டேட்டிவாக அவங்களுக்கு அவங்களும் இந்த என்விரான்மெண்ட்டில் இருக்கிறதுனால அவங்களுக்கு எந்த விதமான டிஸ்ட்ராக்ஷனும் இல்லாமல் அவங்களால பண்ண முடியும். ஸோ இது கிரியேட்டிங் அன் என்விரான்மெண்ட், அடாப்டபிலிட்டி பற்றி பேசினோம், கிரியேட்டிங் அன் என்விரான்மெண்ட் நிறைய பேர் இங்கே பேசினோம். அந்த மாதிரி ஒரு என்விரான்மெண்ட்டை க்ரியேட் பண்ணி அவங்களுக்கு ஒரு ப்ரைடை க்ரியேட் பண்ணும்போது அந்த ஒரு ப்ரெஷர் சுச்சுவேஷனை நம்ம ஓவர் கம் பண்ணக்கூடிய ஒரு வாய்ப்பு இருக்குது அப்படிங்கிறத நான் நம்புகிறேன். ஏன்னா எல்லாருமே வேலையில் ரொம்ப இன்ட்ரெஸ்ட் பண்ணுறதில்ல. இப்போ இவர் நரேஷ் சார் சொன்ன மாதிரி ஷட்டில்ஸ் அண்ட் நீடில்ஸ் இன்ட்ரெஸ்ட் உருவாக்கக்கூடிய ஒரு இது கார்பெட்ஸோ அதுவோ பண்ணலாம். பட் இப்போ நாம் பண்ணுற இண்டஸ்ட்ரியிலலாம் அந்த மாதிரி இருக்க வாய்ப்புகள் இல்லை. அப்போ வந்து அந்த மாதிரி ஒரு பாசிட்டிவ் திங்கிங் அவங்கள்ட்ட கான்ஸ்டண்ட்டாக உருவாக்கிட்டு இருக்கணும். அவங்களுக்கு மென்டர்ஸ் இருக்கணும், அவங்களுக்கு பட்டி ஸ்கீம்லாம் இருக்குது. அதாவது அவங்கள சீனியர் பீப்புள் எப்படி 2 ஜூனியர் பீப்புளை வந்து எப்படி கான்ஸ்டண்ட்டாக டெய்லி அவங்களோட இன்ட்ராக்ட் பண்ண வச்சு அவங்களுடைய ஏதாவது மன தாங்கல்களோ இல்லை மன அழுத்தங்களோ அவங்களுக்கு இருந்தாக்கா அதை வந்து இன்ஸ்டண்ட்டாக ரிலீவ் பண்ணக்கூடிய ஒரு வாய்ப்புகள்லாம் உருவாக்கி கொடுக்கலாம். அது மாதிரி in a limited way we attempted that in the shop floor, which is very highly risky environment where we have to they have to constantly work with machinery, okay, day in and day out. ஸோ என்னால் குறிப்பிட முடிஞ்சது அவ்வளோதான். நீங்கள் கேட்டது ஒர்க் பிளேஸ் ரிலேட்டட் மென்டல் ஸ்ட்ரெஸ் இன்னும் ஒர்க் சுச்சுவேஷனில் எப்படி ஹேண்டில் பண்ணுறது. ஐடி பற்றி என்னால் பேச முடியாது, ஏன்னா ஐடி பற்றி இப்போ ரீசெண்டாக நிறையா இதெல்லாம் போயிட்டுருக்கு ஸ்டோரிஸ்லாம். ஓகே, ப்ரெஷர் சுச்சுவேஷனால் அவங்க வந்து இதுவானாங்களா, அதுக்கு வேறு விதமான காரணங்களும் இருக்கலாம். அதை நம்ம கமெண்ட் பண்ணக்கூடிய தகுதி எனக்கு இல்லை. நான் மேனுஃபேக்சரிங் இண்டஸ்ட்ரி மட்டும் தான் பேச முடியும். உங்கள் கொஸ்டினுக்கு ஓரளவுக்கு ஆன்சர் பண்ண முடிஞ்சதுன்னு நினைக்கிறேன். தேங்க்யூ. தேங்க்ஸ் மிஸ்டர் ரவி.
சாரப்பா நான் கொஞ்சம் ரெஸ்பாண்ட் பண்ணுறேன். ஸோ ஒரு நிறுவனத்தில் பார்த்தீங்கன்னா யூ நீட் டு ஹேவ் அடிக்குவேட் kiosks where you also have wellness programs for the employees or also like type A personality where they drive towards perfectionism. But rather, if you're looking at productivity and if there is some anxiety related to that sort of productivity, it's essential according to my understanding. Because if you need some sort of boundaries or standards that you need to draw and to say that yes, service delivery is of this sort. Especially mental health is very loosely grafted as far as services are concerned, because we take it for granted thinking that the individual who's the recipient is probably most important. But the person who delivers the mental health service is probably not taken too seriously, because their time, their costing, their mental health, all of it is seen as a secondary factor. But in a lot more other profit-making companies, I think what at least I have seen and at least what our organization has done is to create more of support systems within the teams, and also having a system in place as part of human resources department is concerned, where people can access that sort of psychological services or psychosocial services, where you're in a position to seek support when you're not doing well. Also to have certain mental health breaks, that's also very essential, so that you don't keep continuing to work, because it's a lot of pressure otherwise, because the self-stigma also plays a huge role here. Probably everybody else is able to see me as a normal person delivering well, but probably I'm going through 100 things in my head where I feel that I'm too slow than what I was. Third thing that we can do is where you also have some sort of a support system where a group of people, a homogeneous group probably, who can come together in terms of also voicing out what their needs are as much as they can share, because otherwise you feel very isolated in this journey. So therefore, in an organization, having these sort of systems in place will help. And mentorship, I think one common thing everybody spoke about is having a good mentor. So if you're in a position to speak to that mentor, also if the mentor is available to you when you have this sort of distress, and also if you're in a position to understand the mentor level expectations from you, draw it out, chart it out in terms of what those expectations are and how much you can convert those expectations into productive outcomes, because that understanding needs to be on the same page. Otherwise, one may feel that the employer may feel that the employee is probably doing much lesser, where the employee may think that they're doing much more than what is being expected of them.
Panel members. Sir, I have a question to Dr. Vijayakumar sir, IPS. Dr. Vijayakumar sir, IPS. Sir, you are told about the Kaval Karangal and the team பத்தி சொன்னீங்க. So அந்த ஆஃபீஸர்ஸ்க்கு எல்லாருமே நீங்கள் ஏதாச்சும் ஸ்பெசிஃபிக் ட்ரைனிங் கொடுக்குறீங்களா சார் டு டீல் வித் மென்டல் இல்னஸ் பீப்புள்? ஐ வாண்ட் டு நோ அபவுட் தட் சார். தேங்க்யூ.
They are under continuous training program இருக்குது இந்த மாதிரி இருக்கிறதுல. இட்ஸ் அந்த டீம் லாஸ்ட் 2 இயர்ஸாக இருக்கிறாங்க. They have a tie up with the NIMANS பெங்களூர்ல இருந்து. How to approach a call if the call sometimes made by the family members, how to speak to them, then a team goes there for rescue, how to approach that. They will be sometimes violent, sometimes they will be very depressed, they wanted to stay aloof sometimes. So, on the situation, you have to deal with and how to interact with the paramedics who come there. So, they have been trained, but a lot more needs to be done. Not only in the particular team, all the stakeholders, training, but we are depending on professionals. Demands later, we have a team constantly interacting with them, and the standard SOPs is the training has to be updated half-yearly. Every 6 months, the training has to be done. But sometimes for various reasons, but whenever we are in need of help, we always have a team there in Demands, and we are coordinating with them.
Just want to add on, sir. காவல் கரங்களுக்கு வந்துட்டு நம்ம வந்து 3 months training program வந்து ஸ்பெசிஃபிக்கா to deal with homeless people with mental health. Complete பண்ணியிருக்கோம். This is more to do with their own self-care. First of all, how to take care of themselves and how to deal with those who are in need. Because when they are going out to the community, அவங்க வந்து போகும்போது homeless people வந்து multiple situationல இருப்பாங்க. How to handle those situations and என்ன மாதிரி referral system அவங்களுக்கு இருக்கணும், அதை எப்படி வந்துட்டு அவங்களுக்கு அந்த resources எப்படி வந்து அவைலபிளாக இருக்கணும் அப்படின்றதுக்காக ஒரு syllabus curate பண்ணி we have already started that. Apart from the regular training that we have with police, this is going to be an ongoing effort with the BAM and along with MSSW as well.
Thank you so much. First Banyan ku na thanks பண்ணிக்கிறேன். Shine Trust வந்து வந்திருக்கோம். So பிரேமா மேம் சொன்னாங்க, அதாவது மென்டலி டிசபிள் ரொம்ப முடியாதவங்களை வந்து நாங்கள் ரெஸ்கியூ பண்ணும்போது கருணையின் அடிப்படையில் ரொம்ப இறக்கம் பாவம் ஏதாவது நமக்கு சொல்ல தெரியும், இது தேவை அது தேவைன்னு அவங்களுக்கு எதுவுமே தெரியாதுன்னு சொல்லிட்டு நாங்கள் ஹோம்லெஸில் இருக்கிற எல்லாரும் ஆதரவற்ற மனநல பாதிக்கப்பட்டவங்களை ரெஸ்கியூ பண்ணியிருக்கேன். பட் இங்கே வந்தது வந்து எனக்கு ரொம்ப எனக்கும் ஸ்ட்ரைக்க என்னை திருப்பி போட்ட ஒரு விஷயம் நீங்கள் சொன்னீங்க, ஆலமரமாக பேனியன் இருக்காங்க, நம்ம ஒரு அரச மரமாக இருக்கலாமேன்னு சொல்லிட்டு ரொம்ப தேங்க்ஸ். அது இன்ஸ்பைரிங்காக இருக்குது எங்களுக்கு. பிகாஸ் அவங்களுக்கு வந்து எஜுகேஷன் கொடுக்கணும், அவங்க லைஃப்பை கொஞ்சம் நம்ம மாற்றலாம் அப்படின்ற ஒரு எண்ணம் எனக்கு இங்கே வந்து யோசித்தேன். ஏன்னா இறக்கம் பட்டிருக்கோம், அவங்களுக்கு நம்ம அவங்கள சேவ் பண்ணணும், அவங்களுக்கு சாப்பாடு கொடுக்கணும், அவங்களுக்கு ஷெல்டர் கொடுக்கணும், இதெல்லாம் ஓகே. பட் அவங்களுக்கு எஜுகேஷன் கொடுத்தா இவ்வளோ டெவலப்மெண்ட் கிடைக்கும் அப்படின்றது வந்து ஒரு பெரிய விஷயம். ஸோ இப்போ எங்களுக்கு காவல்காரங்கள் டீமில் வந்து எங்களுக்கு ட்ரைனிங் கொடுத்துட்ருக்காங்க. எவ்ரி சாட்டர்டே நாங்கள் அங்கே அட்டென்ட் பண்ணிட்டுருக்கோம். ஸோ அங்கே லலிதா மேம் வந்து பார்த்திங்கன்னா நிறைய விஷயங்கள் ரொம்ப ப்ராக்டிக்கலாக எங்களுக்கு சொல்லி கொடுக்குறாங்க. எப்படி ஐடென்டிஃபை பண்ணுறது அதெல்லாம் எங்களுக்கு ஓரளவுக்கு தெரியும். ஆனால் பட் லீகலாக என்னென்ன இஷ்யூஸ் இருக்குது, நம்ம எப்படி ஹவு டு ஹேண்டில், அங்கே போய் என்ன பண்ணலான்றதெல்லாம் ரொம்ப தெளிவாக அதை எங்களுக்கு இது பண்ணுறாங்க. ஸோ இங்கே ஸ்டூடெண்ட்ஸ் கூட இங்கே உட்காந்துருக்குது நான் பார்த்தேன். என்ஜிஓ தானே மீட் சொன்னாங்க, ஆனால் இங்கே ஸ்டூடெண்ட்ஸ்லாம் இருக்காங்களேன்னு வரும்போது கொஞ்சம் யோசித்தேன். பட் இவங்களுக்கு தான் அது போய் சேரணும். ஸோ நம்மளுடைய ஃப்யூச்சர் வந்து நம்முடைய அந்த சார் கேட்டார், வேலை செய்கிற இடத்துலையே இந்த மாதிரி மனநலம் பாதிக்கப்படுற வியாதி வந்துருதேன்னு சொல்லிட்டு. ஸோ எல்லா துறையிலையுமே டிப்ரெஷன் ரொம்ப ஜாஸ்தியாக இருக்குது. ஸோ அதுக்கு என்ன பண்ணணும், நம்மளுடைய ஹெல்த் வைஸ் இல்லாமல் நம்மளுடைய மென்டலி நம்ம அதை ஸ்ட்ரென்தன் பண்ணுறதுக்கு என்ன பண்ணணும், என்னெல்லாம் நம்ம அதை ரெக்கவரி பண்ணணுன்றதுக்கு இன்னும் கொஞ்சம் நிறைய ட்ரைனிங் ஸ்கூல் லெவலில் காலேஜ் லெவலில் கொடுத்தீங்கன்னா இன்னும் ரொம்ப நல்லாயிருக்கும். தேங்க்யூ ஸோ மச்.
இப்போ மனநலம் பாதிக்கப்பட்டு ஹாஸ்பிட்டலில் இருக்கும்போது ரெக்கவரி ஆகி வீட்டுக்கு போகிறோம், திருப்பி வீட்டில் பாதிக்கப்பட்டு ஏன் வெளியே அனுப்பணும், ஏன் வீட்லேயே வச்சுக்கூடாது அவங்க, அதுக்கு ஒரு கொஸ்டின் பதில் சொல்லுங்கள்.
வீட்டில் வச்சுருக்க கூடாதுன்றது வந்து அந்த வீட்டில் இருக்கிறவங்க தான் முடிவு எடுக்கணும் ஃபஸ்ட்டு. ஆனால் சில சூழ்நிலையில் என்ன ஆகிடுதுன்னு வந்து அந்த வீட்டில் இருக்கிறவங்க வந்து இப்போ வசதி இருக்கிறவங்க யாரும் விட போகிறது இல்லையே. வசதி இருக்கிறவங்க வந்து வீட்டிலே ஒரு நர்ஸ் வச்சு கூட பார்த்துருவாங்க, இல்லை ஹாஸ்பிட்டலே நிரந்தரமாக அவர் வந்து க்யூர் ஆகிட்டு வீட்டுக்கு வர கூட பார்த்துருவாங்க. வசதி இல்லாதவங்க, அவங்க பிழைப்புக்கே வேலை இல்லாதவங்க, அவனுக்கு சாப்பாடுக்கே வழி இல்லாதவன் தான் வந்து இந்த மாதிரி வெளியே வந்து, ஏன்னா இவரை தனியாக வந்து வீட்டில் சும்மா இருக்க மாட்டாங்க. ஏன்னா அப்படியே ஒரு இது என்னென்னா, கரெக்டான டாக்டர் யார்கிட்ட கூப்பிட்டு போனோன்னு அவங்களுக்கு தெரியாது ஃபஸ்ட்டு. ரெண்டாவது வந்து நம்ம கிராமத்தில் பேசுவாங்க இல்லையா, பேய் வந்துடுது இவனுக்கு அப்படின்னு சொல்லிட்டு வந்து அந்த எண்ணத்தில் தான் வந்து இன்னமும் வந்து திங்கிங்கே இருக்குது. அதனால தான் ஏதாவது சாமியார்கிட்ட கூப்பிட்டு போகிறது, இல்லை ஏதாவது தர்காவில் கூப்பிட்டு போயிடுறது, அவன் முடி பிடிச்சி அடிக்கிறது, இந்த மாதிரி விஷயங்கள் வந்து இன்னும் நிறைய பார்த்துருக்கீங்க இல்லையா. இன்னும் அது வந்து நம்ம இன்னும் அதனால தான் வந்து எல்லாருக்கும் இது பற்றி ஒரு விழிப்புணர்வு தேவை. இது வந்து இந்த மாதிரி பிரச்சனை இல்லை, ஒரு மருத்துவரை பார்த்தா சரியாயிரும் அன்றது வந்து முதல்லையே தெரிய மாட்டேங்குது. அது ரொம்ப தீவிரமாக பிரச்சனை ஆகும் பொழுது அவர் கண்ட்ரோல் பண்ண முடியாமல் நம்ம ஏதாச்சும் கூட கேட்க மாட்டார், நம்மளை அடிக்க வருவார். ஸோ அந்த மாதிரி ஒரு அக்ரெசிவாக வந்து ஆளை மாறும் பொழுது வந்து வீட்டில் இருக்கிறவங்க வந்து சரி நம்ம சமாளிக்க முடியல இவரை விட்டுறலான்ற ஒரு மனநிலைக்கு வந்துடுறாங்க. இப்போ யாராவது வந்து அவருடைய சொந்த பையனோ அப்பாவோ வந்து வேணுமென்னா விட்டுறணும்னு நினைப்பாங்களா? உதாரணத்துக்கு வந்து ஒரு டைமில் வந்து ஒரு 5 years பேக் வந்து ஒரு ப்ரெக்னெண்ட்டை விட்டுட்டு போயிட்டாங்க. ஓகே, அங்கே இங்கே ரெஸ்கியூ பண்ணதுக்கப்புறமா தான் ஷெல்டரில் வச்சு அப்புறமா டாக்டர்கிட்ட செக் பண்ணும்பொழுது தான் ப்ரெக்னென்ட்டுன்னு தெரியுது. அந்த பொண்ணுக்கு எதுவுமே தெரிய மாட்டேங்குது, சொல்ல தெரிய மாட்டேங்குது. நம்மளை எங்கள் எம்எம்சியில் இந்த ஹாஸ்பிட்டலில் வச்சு எல்லாமே வந்து பிரசவம் ஆனதுக்கப்புறமா அவங்களுக்கு ட்ரீட்மெண்ட்டு கொடுக்க வந்து அந்த ஃபேமிலி ஹிஸ்ட்ரி சொன்னதுக்கப்புறமா அவங்கள வர சொல்லி திருப்பி கொடுத்து அனுப்பும் பொழுது வந்து அவன் சந்தோஷமாக கூப்பிட்டு போகிறான் வீட்டுக்கு. இப்போ யாரை வந்து நம்ம வந்து ரெஸ்கியூ பண்ணி அனுப்புகிறோமோ அவங்கள ட்ரீட்மெண்ட்டு கொடுத்து குணமானதுக்கப்புறமா அனுப்புனவங்க எல்லாம் மறுபடியும் திரும்பி விட்டது கிடையாது. யாருமே வந்து மறுபடியும் ரோட்டில் விட்டதே கிடையாது. ஆனால் அவங்களுக்கு தெரியாமல் எப்படி அதை அணுகிறது, அந்த பிரச்சனை எப்படி சமாளிக்கிறதுன்னு தெரியாமல் அவங்களுக்கு சமாளிக்கிறதுக்கு உண்டான வசதி வீட்டில் இல்லாதவங்க தான் அந்த மாதிரி பண்ணுறாங்க. எல்லோரும் பண்ண போகிறதில்ல.
எல்லாருக்கும் என்னோட பாராட்டு. சபையே நிறைஞ்சிருக்கு, இவ்வளோ நிபுணருங்க பேசுகிறாங்க. ஸோ கண்டிப்பாக மனநலமும் சரி ஆதரவற்றவங்களும் சரி எல்லாருக்குமே நிறைய இதில் பெனிஃபிட் கிடைக்கும்னு நம்புகிறேன். அவங்க கேட்ட கேள்விக்கு ஒரு சின்ன பதில் பேனியன்லேருந்து இருக்குது. ஹோம் அகெயின் அப்படி வீட்டில் இருக்கவங்க ஏற்றுக்கலன்ற பட்சத்தில் ஹோம் அகெயினும் இருக்குது. ஸோ அது ஒரு வழி இருக்குது. ரெண்டாவது வந்து நான் இந்த இதில் ஒன்று சொல்ல விரும்புகிறேன். அதாவது ஒர்க் பிளேஸ் அப்படின்னு சொல்லும்போது நிறைய முறை நம்ம ஏதோ ஒரு ஃபேக்ட்ரி ஆஃபீஸ் அப்படின்னு நினைக்கிறோம். பட் ஒருத்தரோட ஒர்க் பிளேஸ் இன்னொருத்தரோட இதுவாக இருக்கலாம். ஸோ நம்ம ஹோமில் நம்ம போயிட்டு ரெஸ்ட் எடுக்கிறோம், பட் நம்ம வீட்டில் வந்து வேலை செய்கிறவங்க இருக்காங்க. ஸோ நிறைய இந்த டிஸார்கனைஸ் செக்டர்லாம் இருக்குது. ஹோம்லெஸ்னும் போது நம்மளோட ஒர்க் ஸ்பேஸ் அந்த ஹோம்லெஸ் ஸ்ட்ரீட்டும் இருக்குது. ஸோ இந்த ஒர்க் ஸ்பேஸ்ன்றதை இன்னும் கொஞ்சம் வைடன் பண்ணணும். அண்ட் ஒர்க் ஹெல்த்தை பொறுத்தவரைக்கும் இன்னொரு முக்கியமான விஷயம் இவர் ஷிபு நிறைய சொன்னார். பட் இன்னும் ஒரு விஷயம், ஒரு இத்தனை நிபுணர்கள் நான் வந்து ஆக்குபேஷனல் தெரபிஸ்ட் தொழில்முறை மருத்துவரை பார்க்க விரும்புகிறேன். ஏன்னா அவங்க வந்து ப்ரிஸ்கிரைப் பண்ண முடியும் என்ன மாதிரி நீங்கள் மோட்டிவேஷன் அதெல்லாம் நிறைய சொன்னீங்க. ஸோ யாருக்கு எது இது பண்ணலாம் அப்படி. அர்ச்சனா மேடம் சொன்ன அந்த நம்ம கொஞ்சம் சம்டைம்ஸ் பரிவில் வாங்குகிறோம் ஒரு பொருள், இன்னும் கொஞ்சம் தரமாக பண்ணால் இன்னும் நல்லாயிருக்கும். பட் முதலாவது பரிவுலையாவது வாங்குங்க. ஏன்னா வாங்குறது முக்கியம், ஏன்னா வாங்க தான் அது வளரும். ஸோ அதனால் வெளியவும் எங்கள் பொருள்லாம் இருக்குது, கண்டிப்பாக வாங்க. தேங்க்யூ.
Good afternoon, one and all. So I am Govt from MSSW Mental Health. So my question is for Vijayakumar sir. So my specific question is how the current mentality of youngsters. Why I ask this question means before I come in this street Chennai, so I searching for colleges for study. But when I asked some college about. So they says that college is for that college do some violence, you will not go. So அந்த காலேஜ் போகாத, அந்த காலேஜில் வந்து ஓப்பனாக சொல்ல போனால் ரவுடிசம் நடக்கும் அப்படின்றாங்க. ஸோ இந்த ஒரு கரண்ட் மென்டாலிட்டி ஏன் இந்த மாதிரியான ஒரு மென்டாலிட்டி வருது, அதை வந்து எப்படி ஹேண்டில் பண்ணுறது, நீங்கள் எப்படி ஹேண்டில் பண்ணுறீங்க, ஸ்டூடெண்ட்ஸான நாங்கள் எப்படி ஹேண்டில் பண்ணுறது? ஏன்னா ஒரு கல்லூரி வரோம், ஸோ அந்த இடத்துல இந்த மாதிரி ஒரு விஷயம் வரும்போது எப்படி நாங்கள் ஹேண்டில் பண்ணுறோம்?
நீங்கள் கேட்குறது ஐ அண்டர்ஸ்டாண்ட் வயலன்ஸ் இந்த யங் ஜெனரேஷன் இருக்கிறது இன் ஜென்ரல் கேட்குறீங்க. ஒரு காலேஜுக்கு சில காலேஜஸை டேக் பண்ணுறாங்க, வயலன்ஸ் நிறையா இருக்குங்க. தட் இஸ் ஒரு பெர்செப்ஷன் தான் அது. காலேஜ் அப்படிங்கிறது இஸ் அ மைக்ரோகாசம் ஆஃப் த அவுட் சைட் சொசைட்டி. நார்மல் சொசைட்டியில் என்ன இருக்கோ அது ஒரு பார்ட்டு தான். எந்த ஒரு இன்ஸ்டிடியூஷனும் எந்த ஒரு ஏஜென்சியும் இந்த இதே ஸ்டூடெண்ட்ஸ் வெளியில் வேறு காலேஜ் ஸ்டூடெண்ட்ஸ் தான் அங்கேயே இருக்க போகிறாங்க. ஸோ இட் இஸ் பேசிக்கலி a perception. நம்ம மற்றவங்க சொல்கிறது எல்லாமே நம்புறதை விட நார்மலாக வாட் ஆக்சுவலி அந்த மாதிரி அந்த காலேஜ் ஸ்டூடெண்ட்ஸ் மேலே எவ்வளோ வழக்குகள் போலீஸ் ஸ்டேஷனில் வயலண்ட் பிஹேவியருக்கு ஏதாவது என்கொயரி இன்ஸ்டியூட் பண்ணியிருக்கிறாங்களா, போலீஸ் கேசஸ் இருக்குதா செக் பண்ணி பார்த்தீங்கன்னா அப்படி எதுவுமே இருக்காது. We have done a survey. எந்த காலேஜ் ஸ்டூடெண்ட்ஸ் வந்து இன்வால்வ் இன் மோர் போலீஸ் கேசஸ் எங்கே வயலேஷன் ஆஃப் லா இருக்குது நம்ம எதுவுமே கிடையாது. இட் கட்ஸ் அக்ராஸ் காமனாக எல்லாருக்கும் யூனிஃபார்மாக தான் டிஸ்ட்ரிபியூஷன் இருக்குது. ஸோ அதனால் இது வாட் யூ சே இஸ் அ கொஸ்டின் அரைசிங் அவுட் ஆஃப் அ பெர்செப்ஷன் நாட் பேஸ்ட் ஆன் ஃபேக்ட்ஸ். அதனால் இந்த காலேஜ் வந்து ரொம்ப வயலண்ட்டாக இருக்கிறது அங்கே இருக்க ஸ்டூடெண்ட்ஸ் உண்மையே கிடையாது. ரெண்டாவது யங்கர் ஜெனரேஷனுங்கிறது ஒரு ஜெனரேஷன் அப்படிங்கிறது நார்மலி வி ஹேவ் 35 years as a டைம் பீரியட். நெக்ஸ்ட் ஜெனரேஷன் எப்படி வருதுங்கிறது நம்ம அசஸ் பண்ண முடியாது. இருக்கும் ஒரு கலீல் கிப்ரான் போயம் இருக்குது, யுவர் சில்ட்ரன் ஆர் நாட் யுவர் சில்ட்ரன் அப்படின்னு சொல்லி. ஸோ he says that you cannot enter into the world of the next younger your children. அவங்க உலகம் வேறு இருக்கிறது. ஒரு வயலன்ஸ் நீங்கள் சொல்கிறது நிறைய பேருக்கு இந்த மிஸ்கன்செப்ஷன் இருக்குது. இந்த காலேஜ்னா வயலண்ட்டாக இருப்பாங்க, இந்த காலேஜ்னா படிக்க மாட்டாங்க, ரவுடிஸ்லாம் அந்த காலேஜ் போய் சேருவாங்க. தட் இஸ் அப்சல்யூட்லி நாட் ட்ரூ. அப்படி கிடையாது. எல்லா காலேஜஸும் எஜுகேஷனல் இன்ஸ்டிடியூஷன்ஸ் they impart teaching, they mold, develop the personality of the students. ஸோ அந்த மாதிரி தவறான பெர்செப்ஷன் வேண்டாம். தேங்க்யூ.
Hello.
I'm sorry, but we're running out of time, so can we close with regard to questions? Some of us will be available outside, so whatever questions you have, we will have the time to respond to you. I'm sorry. Thank you.
It's almost lunchtime, or maybe not. So what a fantastic panel, a stellar panel, really wonderful stories, every one of you. Some of the takeaways are, the words are champions of positivity, mental health and physical health. Adaptation is by us and not them. How employers have to, work on kindness. The word first responders was so beautiful. Horticulture, chefs, weaves, empathy, encouragement, ethical responsibility and education. Caregivers wellness, so beautiful. All these are my key takeaways, and a big vote of thanks to such a beautiful panel which is so grounded. And I'm sure we couldn't have asked for a better combination to put this together. Thank you so much, each and every one of you. And I was just reading these beautiful, I don't know whether some of you saw this. These are our people, some of them who are, with mental health issues. One of them says, I'm proud to work in a shop and I finally have a work ID card. It makes me feel so good. It's outside, you must pick these up. The moment I disclosed my mental health service use, the interviewer's tone shifted from interest to indifference. I was no longer a candidate. So I prefer not to disclose my mental health status to the employer. Imagine. So this is the reality, but I think all of you have proved very differently. And I know that it's not an easy journey, it's continuous. And we're really sorry we're running out of time, but as Dr. Archana has said, you can interact, one-to-one with them. So thank you so much, MSSW, the Banyan team, for curating this wonderful learning panel discussion on a very important day, being the World Mental Health Day. And we're really grateful, to all our partners to also sponsor this marvelous learning event. Thank you so much. We have a small token of appreciation from all of us. So I'm going to invite, from the Banyan, Dr. Anbal. Would you like to give it away? Maybe we can start. You can. This is to Miss Premavathy, our pharmacist. Thank you so much. And then we'll go to Dr. Damen Queen. Thank you, ma'am. And then Miss Sharada Dharmaraj. Yes, Sharada, ma'am. Thank you.
Thank you very much.
Mr. Karthikeyan. Mr. Madhusudhan Reddy. And Dr. Vijayakumar. Mr. Shibu Albert. Thank you all for this wonderful event, and and of course Mr. Naresh Ramasubramaniam, sorry. Thank you so much. Yes, yes. Thank you, and maybe for a photo, a picture before we leave.